Asatoma sadgamaya tamasoma jyotirgamaya mrityurma amrutam gamaya. Lead us from asatya to satya. Lead us from darkness to light, and lead us from death to immortality. Om Shanti Shanti. FOGSI is one of the organizations which is leading all of us towards enlightenment, towards knowledge, and yes, through all this networking, we are going towards that one satya of knowledge of truth. This is the true pair, the seeker's admission of a sense of limitedness and a heartfelt cry for assistance in transcendence. Today, the Medical Disorders Committee of FOGSI, under the illustrious leadership of Dr. Komal Chauhan, has organized this Anemia-Free Pregnancy Summit with so many stalwarts and so many leaders on the floor, on the screen. We can see so many of the very knowledgeable people here, leaders of FOGSI on one screen. So I take this opportunity, myself, Dr. Surekha Tayade from Wardha, I take this opportunity to welcome you all to this Anemia-Free Pregnancy Summit. And I now welcome our leader of the chair of the Medical Disorders Committee to kindly come on the screen. Dr. Komal Chauhan, my very dear friend, a really illustrious leader who has been leading us in this campaign through whole of the month of November, and she has been motivating so many of us, all the societies of India, of FOGSI, to participate in this drive to make India anemia free. And really, she has given us that one goal of taking up our benchmark towards BARA, what we call as more than BARA. Dr. Komal Chauhan, as we know, is the medical director of the Chauhan Maternity and Nursing Home. She's the chairperson of the FOGSI Medical Disorders Committee, member of Managing Council of MOGS, AFAG, and she has so many awards to her credit. And basically, she is a true leader as she's taking us all through this wonderful journey of making India anemia mukt and also pregnancy anemia free. So welcome, Dr. Komal Chauhan. I also take this opportunity to welcome on the screen, on the floor, our Vice President, none other than Archana Verma ma'am. She is a very popular personality, and through all the awareness programs she has carried out throughout India, she has become a well-known figure in FOGSI as well as in household well-known figures, because she has carried out so many, the Beti Bachao program she has carried out during her Public Awareness Committee chairmanship. And now she is the Vice President-elect of FOGSI, a very well-known personality. Thank you, both of you. And now I invite Dr. Komal to kindly take over the proceedings.
Thank you so much, Dr. Surekha. It was so wonderful, you inaugurating and starting. And we know that anemia is a leading cause of maternal mortality and morbidity. And we are still battling. We have entered 2020. And we are still talking about anemia, which was spoken a long time when we were studying and doing our residency. Because anemia is still a major public health problem. We have overcome, we have treatment, we are even battling COVID, but anemia still is there underlying. Every medical disorder has an underlying anemia, which again complicates it. So it is the November, which is the month of the Iron Deficiency Day. And FOGSI Medical Disorders in Pregnancy Committee, we thought of taking this anemia-free pregnancy campaign under the leadership of Dr. Alkesh Gandhi. When I discussed with Sir was very kind enough, and I discussed my thoughts, and Sir in fact suggested the name and how to go about and lead this campaign. And this campaign was not only there for FOGSI, various contests and which we did, like the skates, rangolis, slogan, posters, and there were also community activities done, and many people have come forward and done various community activities, and they have actually made awareness to the Anganwadi workers and the trainer of trainers who would actually go to our patient and the pregnant mothers. So lot of it is spoken about anemia, but still there is much to be done. And we alone in FOGSI cannot do, and that was the thing when we thought about making this program as an anemia free pregnancy summit in discussion with Dr. Hima Divakar madam. And we have dignitaries from different organizations who are representing, as we know that our hand has 5 fingers. So we need these people from the 5 different organizations to make FOGSI's goal a very strong goal. And so I welcome everybody, the dignitaries from UNICEF, from NIHFW, from API, NNF, and IPHA, and they all are esteemed panelists, which we'll be introducing later on. But I take an opportunity to welcome our President, Dr. Alpesh Gandhi, who is here, and I really want Sir to speak a few words and give the inaugural and presidential address. Can I have Sir's slide? Please, this is the program copy, and we know Sir is the President FOGSI 2020, and he has taken the opportunity of this COVID, the adversity into an opportunity, and he has done wonderful work regarding awareness, and every small activity has gone up to a very big stature. He has created he has all crossed so many milestones, and always he has created records in whatever activity he's done. And Sir's field of interest is critical obstetrics, and was also chairperson of practical obstetric committee. And he has done numerous successful conferences and so many prizes and to mention the RCOG award with the honorary fellowship FRCOG to him. So over to you, sir. Please bless us and guide us regarding your vision in FOGSI and something about anemia. Thank you, sir.
Thank you, Dr. Komal, for the kind words, generous introduction. A respected past president, Dr. P.K. Shah sir, Dr. Hemaji, my friends, Dr. Rishikesh, Dr. Atul Ganatra, our dynamic Deputy Secretary, Dr. Madhuri ji, Dr. Niranjan, Dr. Krishnendu Gupta, incoming Vice President, Dr. Archana ji, all the esteemed faculties, eminent faculties from different fields, dear friends, a very good evening to all of you. I extend a warm welcome to all of you on behalf of FOGSI and Medical Disorder in Pregnancy Committee, FOGSI. Today's this program webinar has very unique, I can say, initiatives. As we all know that FOGSI's mission is to reduce maternal mortality and neonatal mortality and morbidity across India. And the theme for this year is Safety First for Women of India and FOGSians. And at the same time, we all are knowing that more than 50% of pregnant women are anemic. So we cannot imagine safety of Indian women without treating anemia. We can say a main 2-3 reasons for mortality. Anemia is one of them. It is said that 20 to 40% of the pregnancy related mortality, morbidity, anemia is directly or indirectly responsible. Severe anemia is responsible. So today's webinar, this webinar is very, very important. And we all are always now discussing about the COVID-19 pandemic. But at the same time, we cannot forget this anemia. We also need same awareness among all the citizens of India for this anemia, like we have awareness regarding COVID-19. And this is the way how we can handle anemia. Of course, diagnosis, management, all the aspects are important. And I am happy to see that our committees are also working very hard to reach to community level. As Dr. Komal has mentioned, for this program also, they have tried to reach to Anganwadi workers. And that is really a very, very good step, good action. And it's a proud moment for FOGSI that FOGSI's committees are doing such a good work. These all are the segments where we should reach. They are the, we can say, unreached segments, and we should try to reach to all of them. We should try to join all of them in FOGSI's mission. Then only we can achieve our mission. And I'm happy to see today that Mr. Asber from UNICEF is here with us. Hello, Dr. Asber.
Good evening, Dr. Alpesh, sir. Thank you very much. It's my pleasure and honor to be here, sir.
Good evening. So we have Dr. Harsha Thakur, we have Dr. Mangesh Tivaskar from Association of Physicians. We have representation Dr. Ranjan Kumar from NNF. It's good that FOGSI always believes in strong partnership, respectful partnership, impactful partnership. And this is the way how we can go ahead jointly and we can achieve our mission. This is the mission not only of FOGSI, this is the mission of all our associations, medical associations and Government of India also. Since 50 years, government is also trying hard for this. So let us go hand by hand to achieve this mission. I once again congratulate Dr. Komal Chauhan, Chairperson, Medical Disorder in Pregnancy Committee, for this wonderful initiative, for this hard work. And I congratulate all the committee members of Medical Disorder in Pregnancy Committee for this hard work. Please continue the same work, continue to reach to unreached, continue to spread awareness. Recently, FOGSI has completed 90 days campaigning for the Anemia Free India, and we were able to reach to 5 crore people. So this is the way I'm happy to see that after once 90 days are over, we are still on the same track. And this is very, very important. We cannot leave any agenda just once the period is over for this program. And I would also like to take this opportunity to thank all of you for making FOGSI's program on 22nd November, Sunday, regarding No to Violence Against Women and Girls, for making this program very successful. We have so many eminent faculties from different fields, and all have appreciated the programs like anything. We are still receiving many messages from all of them. And I am thank you to all the presidents and secretaries of 259 societies for making this program successful. With this, I wish grand success to this program, today's program. And today we have a very eminent panel, eminent panelist, moderator. We have very interesting panel on let us begin with making every pregnancy anemia free, walk the talk. And we all know that when Dr. Hema is there, it is going to be a very interesting panel, very interactive panel. So once again, I wish grand success to this webinar. Once again, congratulations to Dr. Komal, Dr. Niranjan and the committee. And I wish all of you happy learning and safety. Thank you.
Thank you so much, sir, for your words of inspiration and guidance. We would like that the team, please, we would like to felicitate sir with a digital plaque. Yeah, this is on the behalf of the committee. We would like to hand over this digital plaque for your wonderful words of inspiration. Thank you very much, sir, for gracing this occasion with your esteemed presence. And this program we have done with convener who has been a co-convener with me and always a guiding person, is Dr. Archana Verma, who is a VP elect of FOGSI. And I would like to call upon Dr. Archana Verma to welcome the office bearers of FOGSI. Over to you, Dr. Archana Verma, madam.
Very good evening, everybody, and most respected Hema madam and Alpesh sir and Pai sir. Also, I can see Dr. P.K. Shah are the most eminent guide and motivator for everybody. Dr. Krishnendu, Dr. Madhuri madams, and all seniors and all seniors. I am really happy. एक एनीमिया के लिए तो मैं भी सर ये कहना चाहूंगी कि वो है ना मुलाकात का दिन, कयामत का दिन आ गया, रफ्ता रफ्ता मुलाकात का दिन बदलते बदलते, तो वो शायद अब कहानी खत्म ही होने वाली है। अल्पेश सर ने बहुत जोर से फ्लैग पकड़ लिया है। 90 डेज में तो आई थिंक इंडिया की जो 40 to 80% वाली कहानी है एनीमिया इन प्रेगनेंसी, वो डेफिनेटली गोइंग टू चेंज एंड आई विश द सेम एंड थैंक यू कोमल एंड बेस्ट विशेस टू ईच एंड एवरी पर्सन।
So we welcome our Vice President in charge for the committee, Dr. Atul Ganatra. As we all know, Dr. Atul Ganatra is a very dynamic Vice President, always guiding and always encouraging everybody. And welcome, sir. And I request you to share few words.
Thank you, Komal. Well, it's an honor to have the President, Dr. Alpesh Gandhi, who's probably one of the most wanted visionaries, I think, in the country today. He has taken FOGSI to great heights. And as we say, converting adversity to opportunity. And I think under his leadership, I don't think when we stepped down in Lucknow from the stage after being, becoming the vice president, we did not know that this would be the situation. But I think hats off to him and his vision that every committee of FOGSI is performing 3 times as good as the others would have done. I think, Komal, congratulations. Wonderful program, excellent academic event. Thank you, Dr. Alpesh Gandhi, for guiding us so well. To all the office bearers, Dr. Madhuri Patel, Dr. Hema Devakar, who knows me from my undergraduate days. Namaskara, madam. And Dr. P.K. Shah, who we call the Bapu of FOGSI, I think the most knowledgeable person in FOGSI, and every other office bearer, if I miss anybody's name. Thank you very much for giving us the encouragement and being with us in these difficult times. Thank you.
Thank you so much, Dr. Atul Ganatra, sir. And now I would like to welcome Dr. Rishikesh Pai, who is President-elect FOGSI 2022, to share his views and say some words.
Sorry, because I'm on the telephone, I cannot see everybody. Rishikesh,
Hi, Atul.
Cannot forget those 2013 days of when I started Mumbai.
I cannot forget. Without you, we wouldn't have had the toilets then.
Amazing leadership. Thank you, Rishikesh.
Anyway, I am really grateful. Alpesh, as Atul had said, Dr. Alpesh has done a fantastic job. I think it's a learning experience for me also. Like, when we see Alpesh working, we are trembling in our seat because, the kind of work he has done to emulate that is not easy. The amount of work he has been able to achieve and the holistic approach to it, it really amazes me how he has thought of it. And I'm sure you think it is spontaneous, but there's a lot of effort that has gone into him creating this thought process, which is on a very large scale. This is a watershed year in FOGSI's history because it will change our style of functioning in the future. And I must acknowledge his fantastic leadership, especially in this time. It's a fantastic leadership, and I'm learning from him and seeing how I can, sustain it. Achieve what he has achieved. It's going to be really difficult for the subsequent presidents to do it. So anyway, I'm really happy. And, anemia is a very important topic for all of us, as I was reading about it also because, as a FOGSI president, you have to be more holistic. So like 20% mortality is contributed by anemia. And I think poverty and mainly infestation are more the contributory factors. And I was reading that, there is a lot of combination. There's a national already anemia control program is there, which has been well implemented. There is the Association of Pediatrics, which are very much active. The API is active, the IMA is active, and of course the FOGSI. So it's a continuous process, and it's important to take care of adolescent. When they are not married, the women, it's very important to treat them at that point in time, and the strategy has been to treat them in the school as well, and preconception treatment. So when they enter the pregnancy, you need to see that they are anemia free, so that the pregnancy goes well. So this is very important. There are certain hurdles on it. The more is the implementation and the poverty. The poverty is a major hurdle. Anemia is not only a health issue, it's a developmental issue, because as the country progresses and becomes better and better, the anemia level will also go down. More and more people will. And I also feel that we should integrate so we should sustain it also. What Alpesh and all will be doing, we need to sustain that policy. And as far as I am concerned, is that a lot of the policies that have been implemented this year, and I'm sure Shanta and I'm sure we will sustain them. Sustenance is very important. Continuity is very important. The landmark things that he has done, even in terms of, like, remember this, just recently he did the, the paper presentation. What a fantastic concept, and on a large scale. So it is going to become a permanent thing in our FOGSI in the years to come. And of course, now we are having the, I think today the present Secretary General is not there, but the incoming Secretary General is also there, Madhuri, and she is also seeing what is being done. And as we can see here, the great people like PK Shah, my teacher, and Hema, my classmate, is there, and all other, Dr. Mangesh is there, and I'm sure that you'll have a fantastic. And I would like to thank Komal, of course. Without Komal, today's program would, and then your support system, Niranjan, is also around. So thank you very much for all of you. And I hope that we have a fantastic interaction. And yesterday also I was in a program, and I waited till the end because I wanted to learn more and more about other aspects of life other than infertility, so that I can implement them well during my year. Thank you very much. And I can see Pawan also there. So sorry if I have not taken all the names. Dr. Ashbar is also there in our year. I remember that we had called him. And Priyankur and the younger generation is also there. Aarti Luthra is there, Surekha, and a lot of Dato Charu is there. Archana Verma, of course, the queen of public awareness, I call her. And Krishnendu. Thank you very much. Thank you.
Thank you very much, Dr. Rishikesh sir, for those encouraging words. And as you rightly said, Dr. Jaideep Tan, the Secretary General, is going to join later. We are really happy that we have our Deputy Secretary General, Dr. Madhuri Patel. And Madhuri Patel, madam, is very humble and very kind-hearted person, and always encouraging and always guiding and always so supportive. And she has been a very prominent obstetrician and gynecologist practicing in Mumbai and attending all the mortality meetings which is conducted as a FOGSI representative for a long time, and has always witnessed that about the depth about this problem. And madam, I request you to please speak few lines and give your message.
Thank you, Komal, for your kind words. Respected President Sir, Dr. Alpesh Gandhi, PK Shah Sir, Dr. Hema Divakar, Dr. Atul Garetra, Archana, and Dr. Krishnendu, Dr. Rishikesh Pai, Surekha, all my friends, very good evening to all of you. I must say, under Dr. Alpesh Gandhi, all the committee chairs, and under the, of course, dynamic Vice President, all the committee chairs are doing fantastic work. I have been talking on the last, webinar, that our maternal mortality in India is 113 per 100,000 women live birth, which was surveyed in 2016-18. Now we could not reach to the goal, but now SDG goal, we want the maternal mortality to go below 70, per 100,000 live birth. Mortality and morbidity is concerned. So anemia, as everybody has pointed out, that it is a major killer of the mother, as well as the major, it causes major problem as far as the maternal morbidity mortality, perinatal mortality and morbidity concern. India is the first nation who came out in 1972 way back for anemia control program. But somehow the other we could not control it because of some problems. But now it is said that anemia begins during childhood, it aggravates during adolescence, and it's worsened during pregnancy. So let us join with Komal and our presidents and other, our other colleagues to make our India anemia free and reduce the maternal perinatal mortality, morbidity, and maternal perinatal mortality and morbidity. Thank you, Komal, for inviting me to give few words.
Thank you so much, Madhuri Madam. May I have the team to hand over the plaques, display the plaques for Dr. Rishikesh Pai sir and Dr. Madhuri Patel Madam.
So on behalf of the FOGSI Medical Disorders Committee, Dr. Komal, myself, and the whole team would like to give plaques, digital plaques. Support, please show the plaques.
We really appreciate the your presence, your esteemed presence for this Anemia Free Summit. And Dr. Jagdeep Khan will be joining soon. We have Dr. Rishikesh Pai, and we hand over digitally to Dr. Rishikesh Pai.
Thank you, Komal, and
And,
Niranjan, and all the medical committee.
and
Thank
Dr.
you, sir.
Madhuri Patel, Madam. Yeah, Madam, thank you very much.
Thank you, everybody.
So, so after having the blessings from all our esteemed FOGSI office bearers and the seniors, now coming to the most weighted segment of this entire program, and that is the Power Pack panel discussion, moderated by none other than Dr. Hema Divakar Madam. Surekha, will you please introduce Madam?
Thank you. Thank you, Dr. Komal. And it is really a proud privilege for me and honor to introduce Dr. Hema Divakar. Of course, she doesn't need any introduction here in this August gathering. She is very well known, and I can say only that God has, when she was born, he must have shown his brightest star on her, because she is so bright, and not only, she spreads all her light through her to her we can say disciples. We are all her disciples. She is the only Dronacharya who is guiding all the Ekalavyas here. And I would please display on the screen ma'am's bio, the support team, please. Yes, she has been the FOGSI president of 2013, FIGO vice chair, PNCD committee, CEO and chairman of ARTIS, and an Asian Research and Training Institute for Skill Transfer. Ma'am, I have been following you, all your whatever trainings you are doing, even in the Lakshya program. I am there in the group, and you have been doing such a huge job. And I do remember almost 15 years back, you had come to Amravati to lead one talk on anemia. So it is that long back, and since so many years you have been doing the work to make anemia.
Welcome, Hema Madam.
Namaste.
Namaste. And we now invite your panel representatives from all the esteemed organizations who have joined here to discuss the much debatable and the much needed topic of the hour for the country, that is anemia, Anemia Mukta Bharat. We all are striving for, and together we can do. Like if we have a big team, and then we can achieve our goals, what we are planning for. And may I now have the slides of our esteemed panelists? We have with us Dr. Ashbir Gayam. He is currently a health specialist with UNICEF. And before serving UNICEF, he was serving as a health specialist Ethiopia from 2010 to 16, an associate professor and consultant of OBGYN at Addis Ababa University. And he has almost 40 peer-reviewed publications and numerous chapters. And Sir is very active and much cited person. Sir's actually the introduction of all these dignitaries would go into pages, and they're really a pioneer and eminent personalities in our fields. We have just tried to highlight few points about them. Just pardon me if I have missed any points, but welcome, sir. Welcome to FOGSI, and we are really eager to hear from you. Next, to join on the panel, I welcome Dr. Harshad Thakur, who is a director of National Institute of Health and Family Welfare. He has completed his MBBS and MD in Preventive and Social Medicine from our very own prestigious state GS Medical College from Mumbai, and has completed Diploma in Business Management, worked in the PSM department for KM for almost 7 years, and then he has been in the helm of affairs for the ministry with the National Institute of Health and Family Welfare. And welcome to FOGSI, sir. We really want to know how we can collaborate and join hands for this mission against anemia. May I have the next slide? Dr. Mangesh Tivaskar is representing the Association of Physicians of India. He is the gold medalist in medicine and honorary secretary general of National API editorial board of the JAPI Medicine Update Journal, governing body of West Zone representation for ACP, and has delivered more than 1,000 lectures at national and international conferences. Welcome, Dr. Mangesh Tivaskar. May I have the next slide? Dr. Ranjan Kumar Pejevar is a prominent and a most talked about neonatologist from the city of Bangalore. He's a president-elect of National Neonatology Forum, and we are very happy to have you on the panel. Welcome, Dr. Ranjan Kumar Pejevar. And to call Dr. Kapil Yadav. Kapil Yadav has joined All India Institute of Medical Science in New Delhi in 2003 and is currently working as an associate professor for Center for Community Medicine at AIIMS. He is a nodal person for National Center for Excellence and Advanced Research on Anemia control, that is with the Anaemia Mukt Bharat, supported by the Ministry of Health and Family Welfare, and he's also the national coordinator for Iodine Global Network. So he's much into all these national programs, and he has the first-hand information, and definitely he will be contributing a lot of information to our panel. So welcome, Dr. Kapil Yadav. And with that, I hand over to Dr. Hema Divakar, madam, to go on with the further proceedings. Over to you, madam.
Thank you, Komal. Namaskar yet again. Ladies and gentlemen, you will notice that the power-packed panelist today is a witness to the fact that the past, the present, and the future office bearers, FOGSI leadership, FOGSI champions, FOGSI committee chairs, all of them are present here with us, which speaks volumes of the solidarity and the intent and the hope that together we can, coming together, staying together, and working together. As Komal Chavan, the chair of the Medical Disorders Committee, has already said, we have spoken enough. We know what the problem is. We know what to do about it. But still, we have a long way to go on the Anemia Mukta Bharat journey. And we very fondly welcome and invite cross-sectorial stakeholders into this panel to place our thoughts, to see what they expect from FOGSI, what FOGSI expects from them, and how we can really make an impact and make anemia a non-issue in not so near future, but definitely sometime in the future. So welcome to all my esteemed panelists again. There'll be 2 rounds of thought-provoking questions that we will ask each other what the OBGYN's role should be and how we can collaborate, connect, and move forward with much more strength to make a difference. So the questions will start from Dr. Ranjan, moving on to Ashabir and Kapilji and Mangesh and finally Harshad Thakur, because unless the government gets involved, then there can be no propelling movement to make this happen. So Ranjan, welcome again. My question to you, beginning from the baby in the womb and moving on to the newborn, neonate and infancy, that's where we are beginning this panel from. So what in your mind should the OBGYNs be doing? Nip it in the bud, it's called. Okay, so what should we be doing during pregnancy and soon after to give you the best possible neonates in the pink of their health? Ranjan.
Good evening, all, and I'm very glad to be here in the panel discussion regarding anemia in the perinatal period. Thank you, Dr. Hema. Now, there are two things. First is the baby as it comes out. If it has to be pink and nice, forget about the resuscitation and other things. The mother should have been looked after extremely well in the pregnancy period. I'm sure FOGSI and all its members are doing their best. The nutrition of the mother has to be well monitored and well managed, especially in the mid-trimester. The mother's nutrition, because if she is deficient in iron and has anemia, high chances that she will be deficient in many other things also. Yeah. And we all know that an anemic mother has problems during pregnancy and during delivery also. So that will have an direct effect on the baby, the delivery and the wellness during delivery and soon after delivery. So that is one thing. That I will leave it to in the safe hands of my colleagues, the obstetricians, to do that, and they should utilize all their modalities to make sure that the mothers are pink and nice, every mother, and then she will give birth to a good baby. Anemic mother will not produce enough milk. This has been shown in studies. So even that, if the mother a baby has to get breast milk, then she should be a healthy mother. Right. Now, one of the most important thing I want the obstetricians to do is practice one cost-effective method which improves the outcome of newborns, both term and preterm, and that is delayed cord clamping. Right. Which, of course, now a lot of people refer it to as deferred cord clamping, because the word delayed means that we are late. We have not done something on time. So whatever the terminology, the abbreviation remains the same, DCC, delayed cord clamping. This delayed cord clamping stems from the knowledge that there is unused blood in the cord, which legitimately belongs to the baby. Right. So if we delay the cord clamping by 1 minute, we will be doing a whole lot of good to the baby. And this good, in form of extra blood which has gone to the baby, it is known that in the first minute, 70% of all the blood available in the cord and the placenta cord circulation will go to the baby if allowed. Though 3 minutes would be ideal, 3 minutes will give about 80 to 85%. 1 minute, about 80 ml of blood can go if it is deferred by 1 minute. So 1 minute is more than enough, and it will give 40 to 50 milligram per kg of birth weight extra iron to the baby. And if the normal newborn is born with 75 milligrams of kg, this 40 ml you add to it, it will be in triple digits. And this benefit will last almost till 1 year, studies have shown. Right. So it will avoid iron deficiency anemia for the first 12 months of life. And that is the time you start your second line of action, that is exclusive breastfeeding, and then complementary weaning foods at the right time, the right food in the right amount. Now, initially, this research was done only in term infants. And now there's a lot of research backing that even preterm infants, it is good to delay by 1 minute at least. Yeah. You may say that there will be overload of blood to the preterm. No, there will not be any overload. They will have a stable blood pressure. there is less incidence of IVH and better weight gain. And the need for transfusions, you see, usually a 30 weeker, we may have to transfuse once or twice. But if you practice delayed cord clamping, this can be avoided. Delayed cord clamping reduces the number of transfusions in a preterm baby and increases the hematocrit and hemoglobin, not just at birth, but this benefit lasts till 1 year.
Yeah,
so whether it be term or preterm, please delay cord clamping. I know 3 minutes is too long, because the time you will know only when you stand in front of the microwave, when you have to eat something quickly, how long is 1 minute or 3 minutes. But 1 minute should be okay. So my slogan would be just a minute, jam. So I want all of us to be jammers.
Okay.
Jam just a minute.
Thank you, Ranjan. That golden words of advice for that golden minute of delay, so-called delay in the cord clamping. I'm very proud to showcase to our stakeholders that more than 1,200 private centers who have got Manyata certification, who started with a 20% score on the issue of delayed cord clamping, who started with 18% score on exclusive breastfeeding, today have reached 100%, because these two are simple, doable initiatives. So if more and more centers are sensitized for 1 or 2 simple action steps, I think we would have really done something which is so meaningful with a small change which makes a big difference. Thank you, Ranjan, for that simplicity of the message that you have given us. So, well, for till 1 year it is covered, and then afterwards the child starts going to school, and I'm aware of the fact that WIFS, weekly iron folic acid supplements in school, was one of the major programs that UNICEF took up. So, Ashabir, now adolescent anemia care has been one of the strong forte or initiatives through UNICEF. So what has been your experience with that initiative? Has it made an impact? Do we need to do something more, something better? Because FOGSI Adolescent Committee is like really in the forefront of BARA, as Komal said, 12 by 12 initiative of FOGSI. At 12 years, we want the girls to have 12 grams hemoglobin. Ashabir.
Thank you very much, Dr. Hema, and honorable dignitaries of FOGSI and all attendees. This is really a great pleasure and honor for me to present at this meeting. And thank you very much, FOGSI, for prioritizing this very important topic. Anemia is recognized as a major problem, but it is also in many ways a hidden problem. For example, as UNICEF, UNICEF is trying to support, national governments with a reduction of under 5 mortality, which includes now about 60% of under 5 mortality is newborn mortality. So if we look at the major cause of newborn mortality, the list, anemia never comes up there. It's nowhere there. There are many other things. But if you really look at, for example, prematurity, why mothers have premature delivery, then as a risk factor, anemia is very important. If you look at infection, then anemia is behind. So the danger of anemia is it doesn't come up as upfront. It is always behind. If you go to any hospital and look at maternal mortality, definitely if you go through the chart, anemia is always there. But it never comes up in the list of maternal mortality as such. So it is a hidden challenge. As you rightly said, it is a life cycle challenge. The other challenge of anemia is it's a life cycle. It begins in utero, in fact, pre-conception, then in utero, then childhood, adolescence, then it contributes to anemia in pregnancy, and then the cycle continues through the low birth weight baby. So that is another challenge. So first of all, when we think of childhood anemia and adolescent anemia, we have to think of this life cycle issue. All are interrelated, and anemia cannot be prevented by one intervention alone. India has a very strong India is one of the few countries that has a very strong adolescent health program, Rashtriya Kishore Swasthya Karyakram, which is really well outlined with a clear commitment, with a framework, with an implementation program, and a program actually on the ground. So a lot of achievements are being achieved, but not to the extent that the RKSK, for example, has intended. This program, it is going well. The issue, the challenge is coordination. WIF's program, for example, for children is a school-based program, whereas it is a health program. So by definition, it engages two sectors, the health sector as well as the school sector, which is not easy to coordinate. Basically, getting the logistics to the school and then administering it and so on. So because of that, there are a lot of challenges, which UNICEF, we do have, for example, an education section and the health section. We try to support through both. Of course, our nutrition team is in the forefront, but nutrition and health on one side try to support, the logistic part of it, the training and other parts, and the monitoring part. Whereas the education sector is also, it takes place in school. So we try to. So what can FOGSI support? Well, FOGSI is already supporting a lot, and FOGSI should be proud, should be very proud. India has reduced maternal mortality by 70% in the last decade, and child mortality and newborn mortality also by similar amount. And all of this intervention is directly related to support like FOGSI, IAP, and so on. So it is to, what I can say is sustain and strengthen. FOGSI has a presence on the ground. You have a presence, and there is I always call it the interface, the critical interface in healthcare. That is the doctor-client interface and the nurse-client interface. Everything happens on that interface at the end of the day. A lot of push from policy, from the Ministry of Health leadership up to that, but that interface is very critical. For example, a lot happens to get iron folic acid to the facility and so on. But at the end, if you see NFHS, how many mothers get the 190 doses of IFA at the end? That number is always worrying. Why?
So the touch point.
Something is happening in that interface, and that interface is under the control of obstetrician, doctor, nurse, ANM. So what is happening in that interface is it needs advocacy, a lot of advocacy, including this meeting. This is a clear advocacy on behalf of FOGSI. It needs and prioritization. And one thing, for example, as a recommendation I want to give to FOGSI is, of course, anemia is a medical problem, but I am a bit worried, for example, when it is placed under the medical complications team. Anemia is a public health problem.
Right.
Anemia is a public health problem. It's not just a medical complication. It is a medical complication of pregnancy with a huge public health problem. The two are a bit, the focus is on a bit different. So it really needs a public health response. And FOGSI is, I think, at the forefront of that public health response. So just to thank you very much and to sustain what you are doing up to the last member. Thank you very much.
Thank you, Ashabir, especially for your generous appreciation for FOGSI's contribution, because it only inspires us to do more. And as you have rightly put it, Komal Chavan, who is the chair of the Medical Disorders Committee, has rightly linked up with Dr. Archana Verma from the public awareness, and then in an integrated way, we are trying to reach every girl, every woman in every sector to make a difference into the anemia status, inclusive of the deworming, the tablet supplementation, the sensitization, the diet counseling, and all of these, and the support from organizations like UNICEF taken on board, and your generous appreciation will go a long way in strengthening our resolve to do more and to do better. Thank you so much. When coming to the public health, now I shift my focus to Dr. Kapil Yadav, because being in AIIMS, Preventive and Social Medicine Department, just yesterday, Rishikesh also was a witness to a program where we were debating a lot about dilemmas in diagnosis of anemia, thinking beyond iron deficiency anemia. And there were a lot of members who said, no, hemoglobin electrophoresis is a should and a must, should be done everywhere, but we know we can't reach it everywhere. And just a presumptive iron deficiency, and the portion initiative from the government now, because you're also involved in the vast public health experience that you have. Has the Poshan Abhiyan made any kind of difference in reaching out? How do the people in the community relate to it? And what better do you think with the initiatives from your institute are doing, and how can we join hands?
Thank you, madam. Thank you for inviting me. It's a privilege for me to speak here. And I'm speaking on behalf of two organizations. One is Indian Public Health Association, and I bring the greetings from our national president, Professor Sanjay K. Rai. And I'm also presenting AIMS, which has been identified by the Ministry of Health and Family Welfare as a technical institution for Anemia Mukt Bharat.
Right.
So, and I'm thankful for Dr. Ashbergam, who just spoke before me, and putting it in perspective that anemia is primarily a public health problem with a huge medical implications. And very rightly, FOGSI is the front runner or the face of anemia as far as mothers and women of reproductive age group are concerned. So we have been planning to reach out to FOGSI as Anemia Mukt Bharat program, and we are grateful because you are one of the largest professional organization.
Yes.
And if the mountain of anemia in India has to be moved, it will happen through the triangle of FOGSI only. Other people can contribute. So, and especially because huge amount of private practitioners are there in the field, so they can take it forward. Now, coming to your specific question regarding hemoglobinopathies and other forms of anemia.
Right.
So last 5 years or so, there has been a lot of global thinking and churning as far as anemia is concerned.
Mm-hmm.
And now we have broadly this understanding that anemia is constituted by three big chunks that we call. One is your traditional nutritional anemias. The second component is anemia because of infections, which include predominantly chronic infections. The third one is because of genetic disorders or hemoglobinopathies. The proportion varies from population and geography to geography, but broadly, these three are important components. And if you don't address 1/3 of this component, will not be able to make an impact on a national or even state or district level.
Right.
Now, coming specifically to hemoglobinopathies, there have been a lot of interesting work from India also, especially from the tribal pockets of Jharkhand, Madhya Pradesh. Gujarat is one of the leaders as far as the work on hemoglobinopathies is concerned. But the program as a whole has not addressed this problem. And we are very serious. Government of India has come out with the operational guidelines specifically looking at hemoglobinopathies. But you rightly said the challenge remains to have the diagnostics available in the private and public sector, because they have not been systematically looked at. We have successful models in few districts, and like I work in Haryana right now, I'm posted there in a rural field practice area. So Haryana has a very robust program of screening everybody for hemoglobinopathies right at the district hospital level. These experiments need to be scaled up because this is a very significant proportion. And from FOGSI perspective, what we are interested beside this one important area that we would want FOGSI to help us is, as Anemia Mukt Bharat, we are struggling with reaching out to newly married women or pre-conceptional age group.
Right.
Because for other age groups, for under 5 children, for adolescent, for pregnant, for lactating, you have some platform of Government of India available. But these newly married women or pre-conceptional women, they right now are not being reached in the scale that program would want to reach out to them. There are some small programs going in various states, but I think that's where the private sector, and that's where, because the preventive component is. If the woman has conceived, then we are basically what my mentor, Professor Panda, used to say, we are into the business of mopping the floor now.
Yeah.
If you need to close the tap, it's the preconceptional area, especially for mothers, that we have to look at. So that is one area that we need to work on. And one other domain, I think that we are very clear as far as AIMS is concerned, that if we want to achieve a very ambitious target of 3% annual reduction of anemia, that AMB has set out. So we would have to come out of our comfort zone, and the business as usual will not work. So you may have to look at some sort of paradigm shifting intervention in short terms. So our center has been contributing to Ministry of Health, and FOGSI has also been very helpful. There have been various consultations. So one thing we have managed to achieve is to change the diagnostic paradigm as far as anemia is concerned. So now Government of India has adopted digital hemoglobinometers as point of care testing for anemia, right at the subcenter and PHC level. So that was a huge change, policy change that was there, and a lot of policy changes have come, and I think program implementation would not happen also in this year. One other component that we were able to convince the Government of India was to introduce what is known as parenteral iron more aggressively in both primarily in primary healthcare. So the traditional knowledge that it can be done only in tertiary care setup has now, I think we have sufficient global literature available. So it has to be rolled out at primary and secondary level in a much more aggressive way. Some newer molecules are coming, and there is a lot of interesting research domain that is there. So that is one area. And third one that we would appeal FOGSI to help us out, especially the public health community, is on the component of food fortification, because that is the platform, food fortification and dietary diversity, which will form the basis of building your public health preventive and medical interventions. So food fortification is a very underexplored area as far as iron deficiency or folic acid deficiency is concerned in India. We have other successful food fortification programs. So that's where I think FOGSI can act as a champion, because if a gynecologist tells some mother to consume something, more or less it gets done. So that is where I think we would want your help. So with this, I think that is all I have. Thank you so much.
Thank you, Dr. Kapil. This was extremely insightful about the few specific areas which we have in the leadership position been thinking about as well, because it was just about 24 hours ago that President-elect of FOGSI, Dr. Pai, had mentioned about the digital hemoglobinometers and how we have to make the hemoglobinopathy tests available in every nook and corner of the country. So that's a point well taken, and we will
I just wanted to say about the food fortification. I think we need to come out with a single fortification which covers all the deficiencies. We are having fragmentation in policy implementation. Every one single bar which will have protein, vitamin D, vitamin, multivitamins, iron, iodized thing. Can we create one single bar which can be distributed to everyone free of charge? Anyone can take it from anywhere in the country. Walk into anything and just take the bar.
Thank you,
Can we do that?
Your presence in yesterday's anemia meeting, the Grand Anemia Conclave, and today's Anemia Summit proves a point that you're really serious about what you're saying yesterday to today, and I'm sure you'll carry it further for tomorrow, because the shapath or the resolve that FOGSI is taking is that now there's no option, but we have to make a difference. So for that, the key points which Kapilji said about the new point of care and looking beyond iron deficiency anemia, and probably exploring which preconceptional couples FOGSI was thinking about exploring the network of beauty parlors and religious institutions for getting in touch with the preconceptional team of the couples and how we can reach it there. And bar, this is Archana for you, because bara, bar, and Rishikesh's nutritional bar, everything, it has to be put into the public awareness perspective, and you have to, that is the homework that through Kapilji we are wanting to give you. And these are like some very novel but doable initiatives, and thank you so much for your inputs, inclusive of that of parental iron, which every single clinician now, the level of confidence of administering the parental iron has gone up, and therefore it is not too far away that even in the primary health centers this can be executed. One more important Anemia Mukta Bharat anemia guidelines in 2018, one small amendment which we may bring forth through the next study of ours is, today the Anemia Mukta Bharat anemia guidelines of 2018 do recommend the parental iron, but it says for severe anemia and the one who is so close to the third trimester, because we have to save the life of the mother. That's a narrow perspective with which the hemoglobin is envisaged to be built up. But the new thought process is that unless the iron sufficiency is maintained in the mid trimester, where the peak transfer happens to the baby, there could be irreversible neural damage to the baby in the long run, which we cannot get a handle on. So instead of only focusing on the mother's mortality issues in the end trimester, maybe we must also do this and make sure that she is carrying enough of hemoglobin and iron stores to transmit to the baby in the mid trimester itself. So these are new and doable thoughts which we will definitely take it forward. So as how I'm just saying, it all begins in utero. So Mangeshji, we come back to you because anemia, malnutrition, low birth weight baby today is now snowballing into NCD of tomorrow. Yeah, and then all are coming with diabetes, hypertensive disorders, cardiovascular accidents, and flooding your clinics. Okay, what more and what better can we do as an OBGYN community? All yours, Mangeshri.
Thank you very much, Dr. Hema. It's been a pleasure and privilege to be here on this platform. It's such a wonderful thing to see all such galaxies under the one screen now, I would say. And thank you very much. And I bring you greetings from Mumbai. And I wish you all a very belated happy Deepavali and a very prosperous and a happy, safe and healthy New Year to all those beautiful faces that I'm seeing. And it's always a privilege to be there in between, especially Rishikesh. You are going to be really jealous because I'm going to say this, that I'm very happy to be there in all these beautiful faces that I'm seeing here. Most importantly, coming to your point, as Dr. Yadav was talking about, I just was wondering, how this everything snowballs into a kind of a lifestyle disease now we have. Unfortunately, we need to understand that at one aspect of our life, we are probably talking about more of a nutritional related anemia. Of anemia from a nutritional deficiency becomes anemia secondary to a nutritional affluenza that we are all going through. It's the malnutrition, where mal stands for primarily a overnutrition related chronic NCDs that you rightly pointed out. And in fact, we have to all recognize this. In fact, tomorrow in National RSSD, I am giving an oration on the anemia, that is crimson chlorosis, what happens because of the NCDs. So my point here for FOGSI is this, that as you are very much active in creating the awareness about the iron deficiency anemia or probably the B complex or B12 deficiency anemias, we have to also create an awareness about, I would say, a healthy lifestyle, a healthy nutrition, a healthy eating. It's very important to create this, because the anemia, what you see as obstetrician, gynecologists, or even in the teenage, they are all mostly iron deficiencies and nutrition anemias. But as an adults, as a practicing physicians, we all see anemia secondary to the chronic non-communicable diseases, and they are different than anemia of iron deficiency or any other anemia. Why? Because the treatment varies. As you talked about, parenteral iron is a beautiful thing to understand and learn about, but parenteral iron can be sometimes extremely challenging, especially you wrongly administer in a situation where anemia is primarily because of a chronic metabolic disease. Like you're treating some chronic metabolic disease, the patient has anemia, which is generally the feature of a chronic anemia there is not a severe type of anemia. Hemoglobin will be in the range of around 10 to 12, not less than the 10. Usually hemoglobin which goes down below 9 is for sure not anemia of chronic metabolic disease. So we need to understand, we need to, I would say, segregate and draw a fine line. In fact, me, Rishikesh, and few of dignitaries from even we have shared a dais, if you remember, Dr. Hema, in Bangalore in one of the conferences, if you remember that, in a panel discussion, where we have come out with the publication guidelines, the practicing guidelines. We have come out with a position paper of on management of anemia in the chronic metabolic disorders. Here we have to understand, is this the diagnosis of a chronic metabolic disorder related anemia is pivotal for the management and further treatment. And we need to, and as you people were talking about the use of HB electrophoresis and the diagnostic tools. One of the simplest ways of diagnosing probably the chronic anemia of the chronic nutritional deficiency is to simply do a serum ferritin level. Simple serum ferritin level will tell you whether it is an iron deficiency anemia or probably a possibility of a mix of both, or purely anemia of a chronic metabolic disease. As I completely agree to all of you, as a mother, probably you can see to it that your patients, those who are so dedicated and they worship all the gynecologists, like, for the mothers, they are like gods. So they follow the word which comes from a gynecologist's mouth comes as a word from the Lord, the final word of, I would say, decision. So if you can make mothers aware about the healthy nutrition, the continuation of the healthy nutrition, make them aware about what is junk food, what is, the food that the babies need to be properly given, the disadvantages of, current diets that the kids, they prefer to eat outside. These all have to be,
Mangesh, in your practice, when you see a tsunami of the diabetics and
yes,
these chronic NCDs, does your thought sometimes reflect back onto what could have been the birth weight of this particular individual?
yes.
Is he or she of a low birth weight, which has now translated into this NCD, and we should have better woken up and done something about it during her pregnancy?
Yeah, beautiful. In fact, I'll tell you a very interesting fact that you are the champions of this, that Indian babies are the lowest birth weight babies in the entire globe. But still, if you really do a DEXA scan of these babies, or you calculate the serum insulin levels of this baby, or cord blood insulin levels of the baby. In fact, Dr. Yagnik from Pune, Dr. Chitranjan Yagnik, few of you must have heard of his name.
The famous photograph he shows.
Yes, YY paradox that, he has that Yagnik Yudkin YY paradox that he talks about.
Yes.
He has very clearly demonstrated that even we are thin and low birth weight babies, our fat percentage is more, our serum insulin levels are more. So we have got some environmental challenges already. Now on the top of it, you have got this nutritional tsunami happening, right? It's going to kill the whole of the lot of healthy life of the baby. And believe me, this chronic anemia of the metabolic origin or for the metabolic disease is more difficult to treat than to manage any nutritional deficiency anemia. So we
yes, because this is not a quick fix.
Yes, this is not a quick fix, and we need to and we have to get convinced ourselves.
Yes,
you can't blame kids for asking, give me that, give me. We parents, or we being an adults of this generation, we need to be aware about this, and probably this would serve a lot of things for you. And as a FOGSI, as the largest organization of the specialists in this country, I would recommend very strongly that your mothers should see to it that their babies are not overweight, the babies are not obese. Because we, in our clinic, when a patient walks in with a child who is a teenager, we technically feel, oh, the diabetes is walking in, a future hypertension is walking in, a future obesity is walking in. That is not a very happy sign for us.
Yeah.
We need to talk about preventive diabetology, preventive hypertensionology, prevention of NCDs. Really, we need to act now. If now, not now, then probably it will be difficult for us to come back.
So if you haven't done something before, this is your second and the best chances here and now. Thank you very much, Mangesh. And Dr. Harshad Thakur, thank you so much for your patience, because with all the inputs from all the sectors presenting all their thought processes and problems, then the ball is now in your court, because now presently you're occupying the prestigious position of being the director of the National Institute of Health and Family Welfare. And I'm so proud, Rishi, that he's also an alumni of the GS Medical College, where we have spent most of our formative years. So Harshadji, everything lies in bridging the gap between innovation to implementation. What is your thought process, both in the current position and in your past experience, and with linking up with organizations like ours? How can we make things, the needle, move ahead on the pathway of Anemia Mukta Bharat? Harshadji.
Yeah, thank you, madam. And I thanks organizers for inviting me here. So as you rightly said, everything is already been said in past 1 hour, and but I still have few points, so I will add them definitely.
Sure.
So one thing is, yes, anemia is quite prevalent, and we have to get rid of it. We cannot totally eliminate it or eradicate it, but we have to control it. And I will say, as in epidemiology, we have cause and effect model, cause-effect relationship. So anemia is cause of many diseases, and many diseases lead to anemia. So anemia is cause of many diseases, and many diseases effect in anemia.
Yeah.
So anemia is quite important. Anemia is important for gynecologist, neonatologist, pediatrician, even general medicine, cardiologist, geriatrics medicine. So everyone is even including public health. So everyone is concerned with anemia. And also, right now we are facing this COVID-19 pandemic. So in COVID-19 also, anemia is quite important because anemia plays very important role, whether the patient is able to survive or not survive. So we monitor the condition of the patients through anemia also. So coming to the specific question, what role FOGSI can play? So yesterday only we were discussing in ministry, okay, how to develop this as far as this anemia Mukta Bharat is concerned.
Right.
So what role can different organizations play? How to develop the training network? So we were thinking that we might have something like training of trainers, and we can involve national bodies like FOGSI,
Right.
Pediatric Association, Indian Medical Association, even Nursing Association, Indian Public Health Association. So everybody can play important role here. And also, as far as FOGSI is concerned, they can see that whatever programs government is implementing as far as anemia is concerned, they can play quality control role. So whether the program is achieving the quality, maintaining the quality, that is very important. And they should be actively monitoring it. And whenever there are any deficiencies or any issues, they should immediately flag it. So once they are, once we notice them, we should identify them and we should intimate them so that we are able to replan and re-implement. So our main other problem is planning implementation gap. So our planning is quite good. We Indians are very good planners, but when it comes to implementation, then we are very poor. Somebody has said in recent past that out of every 1 rupee, only 5 paise goes to common man. So the same thing happened today also. In this anemia also, we might have a budget of, let us say, 100 crore, but hardly 5 crore goes to actual implementation. So we have to see that every rupees we plan is reaching the community.
Right.
The second important role FOGSI can play is capacity building. So capacity building, so we have to develop a training networks. So training of trainers is important at the state level, at the district level, at the block level, at the community level. So we have to identify good trainers. And second is creating awareness, as already been highlighted in this.
Harshadji, if I may just interrupt, what kind of training do you think the healthcare providers need really? As Komal said right at the start, we kind of know how to go about managing this, but it's not getting done. So where is that gap and how do we envisage to bridge that?
Yeah, so that is a very difficult question because training needs are not static, they change. So we have to keep in mind that also anemia is not static. If somebody who is not anemic might turn anemic 1 year afterwards, or that person might be affected by a certain disease, and then he or she can develop anemia. So similarly, we have to see the training need assessment. So this TNA, training need assessment, has to be done periodically, regularly, and we have to accordingly, dynamically change our plan. So we have to identify our trainers. We have to keep in mind that these trained trainers might shift elsewhere. So we have to keep the new batch ready. So that is also important. So FOGSI can have their uh, uh, state branches, district branches ready for this particular thing. Second thing is awareness. So we have to see that awareness reaches the common man. That is also important. So not only in English, Hindi, but all the regional languages, we must have concrete plan as far as how the common man, common boys, common girls, even in school going children, non-school going children, they are aware about what is anemia and what can be done to prevent and to get rid of the issue. So that is also important. So awareness is important. And we have to see that whatever, miss, here comes the communication issue. Miss, we have to see that whatever we are planning, that same thing, whatever we want to communicate, that same thing is understood by the person who is going to be communicated. So that is important.
Yeah.
Yeah,
Are there any newer thoughts from NIHFW to implement in an impactful way? Is there anything new happening which FOGSI could quickly hook on to, and our champions will make it happen?
Okay, maybe I can list a few A's here. So it is like availability. So we have to see that whatever treatment plan or whatever communication plan, training plan, it should be available to everyone.
Sure.
And everyone should have proper access to it. Another A. And whatever treatment or whatever plan we have in mind, it is acceptable both to the providers and those who are going to receive it. So acceptability is important. Then accountability. So when we are giving particular task to somebody, that person should be held accountable. If it is not implemented properly, that person should be accountable. Next, I will say affordability. So it should not be costing too much. It should be basic minimum, whatever is possible. And wherever possible, we can subsidize it. But obviously, free programs are deterrent. So we should try to see that there is certain minimum charges, and somebody who cannot obviously afford, we have to keep it free. Next is appropriate technology should be used, another A.
Excellent.
And, another A is awareness. We have already talked about it. And final A is, I will say, there are few areas we have to, as far as geographical areas, we have to concentrate. So one is rural areas, hard to reach areas, then tribal areas, and then finally, even in our urban cities, slum areas. We neglect these slum areas, but these are very important areas. So we try to reach them also. So here, FOGSI definitely can play important role.
Yeah, thank you so very much, Dr.
Hema, can I ask him one question?
Please, Rishikesh.
So I feel that, for example, we have got a pediatrician sitting here, we have got a physician sitting here, we have got a gynecologist sitting here. We are totally fragmented. Why? Like we have got Ayushman Bharat. Why can't we have an integrated program wherein within 6 hours you train all the doctors, you have a digital program, and then implementation has to be integrated. Means in the same implementation in one single point of care, you must cover all the preventables of the pediatric and the adult and the woman together. For example, if there's a gynec, suppose there's a CAM or a gynec, everything, cancer related, stress related, physical assault, antenatal care, everything should be integrated, because we don't have the resources to do everything in fragments. I feel that we are totally fragmented. There are thousands and thousands of NGOs having their own agendas. Why can't there be a dashboard where all the NGOs are brought together on one platform, where there can be interaction? Why can't there be integration and focus?
Yeah, thank you, Rishikesh, Rishikesh, thank you for placing this point, because it is both a challenge and an opportunity at the same breath when the point of care and integration, the topic is brought to the forefront. And if you would recognize in the recent past, the IHW Council, Integrated Health and Wellbeing Council, on an initiative called the Shapath, they brought all the stakeholders, inclusive of the NGOs who are ready to support this cause. So this is the next stepping stone with the good intent of all our stalwarts who are here and our champions and the stakeholders from different organizations who will now, I agree that vertical fragmentation will lead us nowhere. Because when we say antenatal care, it should not only be directed towards just how to manage anemia. There is a package of things that needs to be done, and this is exactly what the quality care we hope to give. Because the original vision of establishing a diabetes in pregnancy clinic, we have totally reversed it, because if she has to go separately to a diabetes pregnancy clinic, it will not work out. It has to happen within the same vertical where comprehensively she is to be taken care. So the point is well taken, because you've recognized that there are few things which are easy to do. They're the first few steps, and let's put the best foot together to make the first phase happen, and then we can escalate over that. So thank you so much for your inputs, and I'm sure that all other organizational leaders will also agree to it. With Komal's permission, I want 1 minute final message from each of our participants to the entire community who is watching us, because I strongly believe that each one can do our bit. And if that message is taken into head and heart, and each one of us strive to make our practice anemia free, automatically there will be a perceivable difference in our path walking towards the destination of anemia mukta Bharat. There's one message from Shashi Bala who said about deworming. It's in the chat box. Shashi, the worm infestation, the deworming components have been spoken about within the discussions. And yes, it is an important point, and we always put that as a footnote while instituting anemia care. So the Sat program from the neonatology and the gynecology group led by Ranjan Kumar. Your input first, Ranjan. One minute message from each one of our leaders, please. Ranjan.
Thank you that you brought out the Sat program. Newborn is a continuum of fetus. Yeah. So the care has to be continuous, coordinated. We, people who look after the newborns, we value these services and the help received by the obstetricians. Mm-hmm. May it be antenatal corticosteroid, may it be magnesium sulfate, may it be clamping of the cord, delayed clamping of the cord. We need the obstetricians to help us in making the life of the newborn and the neonatologist both worth living. So you are the people who have influence on the mothers, even newborn screening. You have to promote during antenatal period. And if you have to say, look here, your baby may be premature, a costly medicine has to be administered, they immediately listen to that. And when we mention surfactant, they say, yes, doctor, our doctor had already mentioned it. And the second thing I want to say is this is all a sports of relay. Relay from the obstetricians, before that, the adolescent medicine people, obstetricians, neonatologists, pediatricians, and then to the physician. The baton has to be passed carefully to each other so that it is not dropped in between, and every this thing of the race, every round of the race should be ran by each of the runner with great vigor and great dedication. Only if this relay people do the job properly, then the race will be won. That is my message.
FOGSI champions, are we ready for the run? We would say, yes, we are. Yes, thank you, Ranjan. The Sat initiative, again carried forward to the adolescent group with the UNICEF and the Poshan. Ashabir.
Thank you very much again. And I just want to reiterate that all efforts under Anaemia Mukta Bharat, under RKSK, all, from policy to funding to framework intervention, they end up in one place. That is the client healthcare provider interface. Either it is a doctor with a client, or it is a nurse with a client, or an ANM with a client, or an ASHA with a client. That is the final interface that needs to work if we are to succeed. And existing data is indicating that that is improving every year. If you look at NFHS 1 to NFHS 4, that has significantly improved. But that needs to be now 100%. The continuum of service has to be 100%, meaning every mother that comes to antenatal care must have the detection of anemia. She must be informed, as all the learned colleagues have indicated, about diet, and she must receive that minimum level of iron folic acid, for example, that is mandated. So if that interface works, we will achieve what we plan to achieve. And that is under FOGSI, that is under IAP, that is under IMA, that is within us. We can make it happen. That's what I can say. Thank you.
Sure. Thank you, Ashab Bey. This is an important point I want to raise with Kapilji, because when we discussed with Wish Foundation on the Shapat initiative, the Vadhwani initiative for healthcare, sustainable healthcare. So they mentioned to us, and yeah, I think the data is correct, that 90% plus institutional deliveries are happening, but only 20% antenatal care is happening. So there is a gap there. That's why when FOGSI was very willing to lend support to the PMSMA program to identify the high risks and to do our best bit there, this coverage, how do you envisage that FOGSI can help in improving? Because if the antenatal care is so dismal, then we will land up with even though the delivery happens at an institution, it's not going to have the outcome desired. Kapilji?
Very important point, ma'am. And just I think last week a paper has also come out which documents the coverage of ANC and its various parameters. So now the focus is not only on increasing the coverage, but the quality of ANC care also. And now we have the latest thinking, at least 8 to 10 visits per individual are minimally required for optimal quality antenatal care, and more importantly, birth preparedness and the follow-up in the postpartum period. I'll just like to conclude with one comment that all of us should take a pledge to make Bharat Anemia Mukt now. The science is available. There's a very high political commitment. The program has been launched by the Honorable Prime Minister. All policy documents of Government of India talk about anemia. They are willing to contribute resources, and it is now up to us, the scientific fraternity, the medical practitioners, or the way I want to call them, the health workers. All of us are health workers, to eradicate this scourge from India. We have the evidence, and 21st century is supposedly to be a century of India and the developing world. In 21st century, we cannot afford our pregnant women to have a hemoglobin anywhere less than 11. So every mother, every child, or more importantly, every girl child should have optimal hemoglobin. I think that is where we see FOGSI's role and a leadership role, because all other association would like to follow as far as anemia of women is concerned. So we appeal, and public health fraternity looks forward to FOGSI's leadership in this aspect. Thank you, ma'am.
Sure. Thank you, Kapilji. And it's a very strong resolve and a pledge that FOGSI members, not only the leadership, but each and every member has taken it into their head and heart that we have to make a difference to the anemia scenario in our country. So we once again reiterate that. Mangeshji, in the metro cities, okay, we have the luxury of referring to the physician, but how do you see the postpartum NCD network in the second tier, third tier cities and the rural India?
Yeah, I'm very happy to say that even though we were lagging behind, but we are catching up fast as well. And because of most of the galaxies we are talking about, because of continuous efforts of spreading education, and now COVID being a special times where we have become far more reachable than probably initial days, where digitally we are covering a lot of people and all. So I believe that as your Sat program goes, and in fact I represent now here 4 organizations. Association of Physicians of India, Indian College of Physicians, Physicians Research Foundation, and I also represent the American College of Physicians West Zone chapter. So on this, I can say that we pledge to be there Sat with FOGSI, and those who have an attempt, even a smallest baby step, we would be more than happy to join your leadership in whatever the ways that we can, and to decipher knowledge, to convey, and I would say improve awareness for the digital reach, for probably utilizing this platform for create awareness, whatever best possible that we could offer. I as being a general secretary of all the institutions, I promise you at this platform, in presence of all these galaxies, including the government people, including UNICEF people around, that we would walk together. Let's make it truly Sat. Let's have a pledge.
Thank you so much, Bangeshji. Finally, it always lands up on the desk of people like Harshad Thakur. Surekha Thaide asks, why? We know what to do. We are giving the iron tablets, IFA, we are giving the parental iron, we are doing this, that, and the other. Why are we still having some of our women with 2 grams hemoglobin? That is Surekha's question to you. What is the gap that we need to fill so that this dismal situation ceases to exist? Thakur, Harshad Thakurji.
So, I think this COVID has given us opportunity because everyone is focusing on health and hygiene. So now we can also take this opportunity that everyone also focuses on anemia. So we should use this opportunity positively. Another thing is we should also focus on overall development, overall social and economic development. So FOGSI can play important role to say that education, occupation, and nutrition plays very important role as far if you want to eliminate anemia. Anemia cannot be eliminated directly, but these other factors, social and economic factors, overall development will take care of it. And no other country will come to our help here. We have to do it ourselves. So after 70 years of independence, we are still at almost same level. So that is our own fault. So we have to do it ourselves. And if we achieve this overall social development through these social sustainable development goals, we'll definitely be anemia mukt. Thank you.
Thank you for ending on a positive note, because hope is one thing and determination is another, which will help us move ahead. And to place on records, the Shapath initiative, where FOGSI has joined hands with IHW, has already bought on the table the Nandaghar initiative of Vedanta Foundation, the Mansi of the American Indian Association, the Vadhwani Foundation initiatives. All of them have already pledged their support to join hands with FOGSI, and now we have more number of stakeholders and players. So the leadership here can be sure to not only pledge, but also, as the panel is titled, walk the talk and go closer to the destination of Anemia Mukt Bharat. Once again, thanks to Komal, who has put us all together in this brilliant program. Very thought-provoking, very motivating, very inspiring, and wanting us to think for ourselves. Yes, we seem to have done something, but enough is not enough, and we need to do a lot more. Sat Sat. Namaskar.
Thank you so much, Dr. Hema Divakar, madam. It was, I bow down to all of you, all the dignitaries and the luminaries who have graced the occasion and discussed the hot topic, the anemia. The panel was real eye-opener. We now know for where we stand and what we still more have to do. And definitely we are together. The alliances are really going to help us. And it was a wonderful discussion. And I thank each one of you to spend your time on this Saturday evening and be with us and share your thoughts. And there are so many messages coming from every FOGSI and from everywhere that a wonderful program is happening, and they are really, really happy to hear the views. Thank you once again, and I would like to felicitate all of you. Team, please share the digital plaques. And I would like to, along with Dr. Hema Divakar, madam, we would like to hand over this to Dr. Ashbir Gayam from UNICEF. Sir, please accept it on the digital platform.
Thank you, Ashbir.
Thank you very
we
much.
We really chased him very hard to make his presence on a Saturday evening, as you said. Thank you.
Really,
Thank
really
you so
an
much.
honor. Really an honor to be part of this meeting. Thank you very much.
Thank you very much.
Thank you for inviting.
Thank you. I would like to present Dr. Harshad Thakur. Thank you very much, sir. You were there from the ministry, joining us, sharing your views. And definitely it was a great discussion. Thank you very much.
Thank
sir.
you. Can I say?
Namaskar, Harshaji. Thank you.
Can I say one more thing?
Yeah,
Yes.
please, sir.
Yeah, actually, NIHFW along with WHO and UNICEF, we are organizing one important symposium on human resources for health on 3rd and 4th December. So I will like to invite all of you there. Thank
Certainly,
you.
sir.
Yeah.
Thank you. Thank you so much, sir. And I now invite Dr. Mangesh Tivaskar, and I thank you on behalf of FOGSI Medical Disorders in Pregnancy Committee. Please accept this digital plaque, sir.
I'm
Thank
truly
you,
humbled,
Mangesh
madam.
ji.
Thank you. Thank you. I'm truly
Thank you.
humbled. And it's such a pleasure. Thank you very much. I am absolutely emotionally touched and I'm really overwhelmed. Thank you very much. And especially to see
so
Dr.
much.
PK Shah, sir. Please accept my humble bows. You
Thank
are
you.
the real Dronacharya. Please accept my
Thank you, Mangesh.
sir, namaskar.
Nice to see you.
From the, yes, pleasure to see you, sir. Yes.
This was one of the best panels on anemia I have ever heard in my life.
Yes, sir.
you so
Very
much.
true, sir.
Thank you.
And I enjoyed it thoroughly, and it is something really positive has come out of it.
Yes, thank you.
Very
Thank you
nice.
very
Thank
much.
you, PK.
I seek your
Thank you.
leave
Thank you,
also.
sir.
I have
Thank
another
you.
program lined up. I
Yeah.
would request your excuse.
Okay.
And
Thank
Yes,
you.
thank you.
Dr. Raju Nagarkatti, thank you very much. It is nice to see you, after a long time and Raju met. And thank you, Rishikesh and everybody. Yeah, bye-bye.
Thank you so much.
Emma madam, it was a pleasure and honor.
Thank you.
very
Thank
much.
you, Mangesh.
Yes, bye-bye, Rishikesh.
Thank you,
very
Mangesh.
much. Yes.
Thank you.
Yeah. Now we like to hand over the digital plaque to Dr. Ranjan Kumar Pejawar, who have put fabulous inputs and the way the association Saath Saath, let's continue more Saath Saath. So please take accept this digital plaque. Thank you very much for being here.
It's my
Namaskara, Ranjan.
pleasure
Dhanyawada.
and my pride to be here in this panel. Thank you, Dr. Hema Divakar. Thank you, Dr. Komal Chavan, Dr. Pai, and all the other experts who took part in this. And I can assure you, there was a slight lull in 2020, but the Saath Saath program will be revived in 2020. As when I take over as president of NNF, I shall definitely revive it because it was one of the most popular programs, and it was led by obstetricians. Though it was organized by the IAP, it was obstetricians who were taking the lead. Thank you.
Thank you, Ranjan.
And now I would like to hand over the plaque to Dr. Kapil Yadav. Please accept this digital plaque. This is our gratitude towards you for spending your time and talking about anemia, and your inputs were really valuable.
Thank you
Thank
so
you,
much,
Kapilji.
ma'am. It's an honor, and thank you, Dr. Komal, Dr. Hema Divakar, and FOGSI. Thank you so much.
Thank you. And how can we forget our ace moderator, Dr. Hema Divakar Madam, who has brought all the luminaries here in FOGSI, and you are our powerhouse and always
madam.
inspiring us. Madam, this is our gratitude towards you from FOGSI Medical Disorders in Pregnancy Committee.
Thank you. Harshit Thakurji was talking about human resource meeting. A really rich human resource within FOGSI, as how you have witnessed today. So we are all here to do our best always. Namaskar.
Komal, can I say?
Yes.
I want to make a comment, Komal.
Yes, sir. Yes, sir. Go ahead.
Yeah. I think what I saw today is that Dr. Rishikesh Pai has been with us since beginning in Anemia Mukt Bharat program. That is
Yesterday
first
also.
thing. Yeah, no, I don't know about that, but at least today I'm witnessing it.
Yeah.
Not only he was very attentive, but he was taking down notes and he was writing. This shows the commitment of an incoming president. I'm very happy to see that Rishikesh will make his year even better than this year. And I was very happy to see him doing this.
Thank you.
So religiously, Rishi. Very happy.
Thank you, sir. That shows our dedication that FOGSI leaders are here to inspire us and they motivate us.
Yes.
And really thankful for that. And we have Dr. Jaideep Tang, the Secretary General of FOGSI. He was held up in an emergency and he is now here and going to share his views. Dr. Jaideep Tang, sir, please.
Thank you,
Thank you very much, Komal. I'm very sorry and I apologize for joining the program late. And I must first compliment that wonderful moderator and panelists and that extremely rich discussion which happened over here. And it was really quite fascinating to hear. Let me first begin by acknowledging the very enthusiastic and hardworking chair of the Medical Disorders in Pregnancy Committee, Komal, for arranging this program and having me here. Well done, Komal. Keep it up. And of course, acknowledge the very enterprising and innovative national coordinator for the program, Dr. Archana Verma. Always a pleasure, madam. I must acknowledge the dynamic president, Dr. Alpesh Gandhi, and the entire team of officers, particularly the vice president, Dr. Atul Ganatra, and Dr. Madhuri Patel, the deputy secretary general, who are here. And of course, as always, the wonderfully ebullient Dr. Rishikesh Pai. Rishikesh, it's always such a pleasure to see you. FOGSI, I think it has been said, believes in the power of partnerships, and it was so wonderful to see so many of the partners, Dr. Ashibar, Dr. Harshad, Dr. Tivaskar, Dr. Pejawar, and Dr. Kapil Yadav, contributing and reiterating their commitment to partnerships with FOGSI and indeed to the cause of eradicating anemia. I know I'm standing between you and Dr. Rekha Divakar's wonderful topic and lecture, which is going to be chaired by Dr. Raju Nagarkatti and Dr. Pavan Dheer. But I cannot help but say that I am also looking forward to not only that lecture, but the snippets on anemia, because the snippets are going to be chaired by my dear friend Niranjan. And you have none other than Dr. Narendra Malhotra, Dr. P.K. Shah, Nandita, Dr. Ramni Devi, Krishnendu, and Dr. Sudhir Shah, who are going to enlighten you during that session. At the end, of course, nothing is successful without a lot of work being put behind the scenes. And for that, I must acknowledge the coordinators, Dr. Surekha Taide, Dr. Sashibala, Dr. Charu Modi, Shaijas, Yogini, Aarti, Priyankur, and Dr. Kanchan Prasad. At the end, let me leave you with maybe 4 sentences, and I hope I'm not overshooting my time here, Komal.
No.
But I would really like to leave you with these 4 sentences which have occurred to me, particularly for something like anemia in pregnancy. And the first thing I'd like to say here is that it's perhaps the audacity, if you will, or the Gordian knot, if you will, of the commonality which surrounds anemia in pregnancy, which I believe is its biggest undoing. It's become so common and so matter of fact that we tend to take anemia in stride. It doesn't really surprise us or shock us anymore when a woman comes with a hemoglobin of 7 or 8. It should ideally shock us into action. A woman should not have a hemoglobin of less than 11. And yet 8, 9, and 7 is something which is accepted as being so commonplace and something which we are so used to that it doesn't shake us out of our daily routine. And I think this is something which we need to address very, very urgently to drive home the message that although 8 gram% is manageable, it is certainly not normal. This is the first thing I'd like to say. The second thing I'd like to say is that, there was talk about some policy decisions around anemia. We've had the NNAP, we've had the NACP, we have the NIPI, and yet there are gaps to be filled. I think Surekha made the point that despite all these policies and interventions, we still have women who come to us with extremely low hemoglobin. And that is perhaps an indicator that although we are filling in the gaps, we are not really filling in the gaps in the places where they are required to be filled. To which, if you look at NFHS 14 data, you will see that the state-wise burden of anemia doesn't really correspond to the normal economic and state health indicators. For example, anemia is at highest in, for example, Delhi, Haryana, Gujarat, places where other health indicators are not doing all that badly. So we perhaps need to relook and have a relook at the gap analysis and trying to ask ourselves the question as to, are we filling the right gaps? And I think this is really so important with anemia, and this taken together with this problem of commonality of anemia is something that we need to address. And at the end, I think if at all it is required, then as a push for policymakers and advocates, we need to start talking about what I like to call in corporate terms CTC, or total cost of ownership. CTC is cost to company and TOC is total ownership cost. And we need to start looking at anemia in that context, because the morbidity around anemia doesn't end simply by providing that patient with iron. it extends much beyond that. If we accept the fact that anemia is responsible for almost 50% of mortality and morbidity, then you need to start looking at the true economic burden of anemia. And I think that would really be something which policymakers and advocates would respond to, because you would then be looking at the strain on the healthcare system as a whole, both in terms of health, human resource, as well as infrastructure, and start taking anemia much more seriously than we have. I'm very sorry for speaking too much, but I am quite passionate about this topic. Thank you very much, Komal and Dr. Archana Verma, for having me here. Thank you.
Thank you, sir.
Thank you so much, Dr. Jaideep Khan, sir. Very useful message you have given, and thank you for being here and encouraging the committee. We would like to hand over a digital plaque to you. The team, can you just show the digital plaque? And this is for Dr. Jaideep Khan.
Thank you.
Made it.
And sir, we wish you a very, 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 very good, and we wish the best for your presidential election also.
Thank you. Thank you.
You are the most wonderful, dynamic person, digital, computer, everything specialist, and we wish you best of luck.
Thank you so much, madam. Thank you. Thank you.
Thank you so much.
Thank you, Komal. Thank you.
Thank you. Now, as we all know, we have concluded the Power Pack panel, but still our program is going into the full swing. We have a very interesting guest talk by none other than Ms. Rekha Divekar, and who is a specialist in herself. She's a professor in chemistry. Her interest is food chemistry, and she's going to share a lot of interesting things to all our viewers and everybody about the special food, how to enrich our food, and and how to go about pre-pregnancy, during pregnancy, all the tips which we all every time require. And I can't wait much to hear from her. And I would now call the coordinator, Dr. Shajas, to take the proceedings further and call our esteemed chairpersons today, Dr. Nagarkatti and Dr. Pavandev. Over to you, Dr. Shajas. Please introduce our session. Shajas has also been the chairperson-elect for the Midlife Management Committee of FOGSI. He is also very dynamic and has coordinated a lot of events for the committee and always been doing his hard work. Over to you, Dr. Shajas, and please invite and call and begin the session. I think he's there, or I take a pleasure to call Dr. Shashibala. You can join in. Sorry,
Yes.
Dr. Shashibala madam is here. She is also the coordinator and has coordinated fantastically the secretary of the Gwalior Society. Ever dynamic, Dr. Shashibala. Please go ahead.
Thank you, Dr. Komal. Great guts and gumption are required to tackle this mammoth problem, and FOGSI has abundance of that. So I'm sure today we have heard so much, and now I invite our chairpersons for the superfood talk by Dr. Rajendra Nagarkatti. I welcome you, sir. He is chairperson FOGSI Midlife Management Committee. He is chairperson MOGS Midlife Management Committee and is executive council member MOGS. He's been past president, joint treasurer, past president, so many he has held posts. So he's the right person to chair this session. Welcome you, sir, Dr. Rajendra Nagarkatti, sir. And second chairperson for this is Dr. Pavandev, sir. And he needs no introduction. He's senior consultant, OB-GYN and infertility specialist. He is from Ahmedabad Society and is president, BOGS, and president since 2006. So he's been an active member and patron, and is chairperson, website committee of AICOG and organizing chairperson. And he has given such motivating talks on anemia, which we have been listening to all this month we have been bombarded. So over to you, sir, chairpersons, please.
Thank you. Thank you, Dr. Shashibala, for the kind words. At the outset, I wish to congratulate our wonderful organization, and all the office bearers, and also the office bearers who are present here today, including Dr. Rishikesh, Dr. P.K. Shah sir, and all others dignitaries for being here and together to fight and tackle this problem in women, and to have an anemia free pregnancy or a anemia mukt Bharat. So it's a wonderful initiative, I would say, of our dynamic chairperson of the FOGSI Medical Disorders in Pregnancy Committee, Dr. Komal Chauhan, who has been doing such wonderful work throughout this pandemic. She's been organizing so many programs, and it's a pleasure to be here, Dr. Komal, to be chairing this session on this very, very important topic of dietary therapy for anemia, because we have a wonderful speaker in Dr. Rekha Divakar, a professor in chemistry who has brought about our own concept of food chemistry. So it's my privilege to introduce my dear friend, Dr. Professor Rekha Divakar. She is MSc First Class in Chemistry, lecturer at Sathe College, Villeparle, retired in 2010 after 35 years of service. She's been practicing organic farming at Sonave near Sapale, just outside Mumbai. And post her retirement, she's been giving talks and conducting workshops and topics like chemistry in the kitchen, yoga, and ahar, staying youthful forever. That is something which would be very nice, madam. Slimmer waist and fuller life, etc. And we have shared the dais together at other places, including at Bhopal, where her talk was very much appreciated. And it would be a real pleasure to hear from you, madam, regarding dietary treatment for anemia, to have anemia mukt Bharat, because especially in the rural areas, the poor Indians medicines, the tablets, of course, the government is providing them, but still the diet itself is a very, very rich source, and that is what we would like to hear from you.
Thanks, Dr. Rajendra and Dr. Komal for inviting me here. Good evening, everyone. It's a great pleasure for me to be here and to listen to all the dignitaries. So I will start with what are the things that you can do to add iron stores in your diet. So there are certain simple things from the kitchen that you can utilize for it. Now, first of all, I will like to tell you about what are the vessels that you should be using when you are cooking. So while cooking, we should use certain vessels which are made up of iron. I would like to show. Now you can see that this is iron ka kadai. And this iron ka kadai we can use for frying. If you are having more people, then what you can do is you can use the bigger one, but otherwise this small kadai will be sufficient. And what this iron pan will be doing is adding iron to the food that you are cooking. And therefore using of iron tawa, iron kadai is very important. I will also like to show you, this is the tawa which we are using, cast iron tawa. Now, instead of non-stick, we must use this cast iron tawa for making dosas or parathas or rotis, whatever it is. And then it will be, we will be having more of iron in our food. Now, this is regarding the vessels that you must use. Besides that, we can have iron-rich foods in our diet, which are very interesting also. And now I will talk about one by one regarding these foods, which are actually can boost your hemoglobin levels. Now, first, I would like to talk about the dry fruits, which you can use. And the first dry fruit that I will surely recommend is black raisins, Kali Draksh, which is called as Kali Draksh. And if you are soaking these munakkas, which are called as, in Hindi they are called as munakkas, manuka in Marathi, and if you are using this for the first thing, as a first thing in the morning, if you can have this soaked raisins, black raisins, then what will happen is you will get initially early in the morning only the dose of iron. So it is very essential for pregnant women to have this as the first thing early in the morning. Now, after this, when I am talking about this Kali Draksh or Munakka, the another thing that I will like to tell or I will recommend for you to eat is the dates. Now, you must be knowing that dates are the rich source of iron, and how you can use this date so that you will get the maximum bioavailability of all the micronutrients in it is you can add these dates to curd. Soak in curd for about half an hour, and then all the nutrients which are present in this, they will, the bioavailability of all the micronutrients will be there, and you will get the advantage of that. The another thing that I will like to show you in dry fruits again is prunes. Now, what are prunes? Prunes are nothing but plums which are dried. Now, these plums, they are very good source of iron, and they prevent constipation also. So, one of the problem in pregnancy may be constipation. And if you are having these prunes, you can have about 3 prunes per day, and then your problem of iron, that is iron stores, will surely increase, and therefore hemoglobin levels will also increase. So in dry fruits, what we have to do is we can use 3 types, and the 3 types, which are 3 types of dry fruits that you must use. Alternatively, you can use, one day you can have munakka or black raisins, one day you can have dates, the another day you can have prunes. So you are having variety also, which is very good, and then you will be getting diverse micronutrients also, because you are not using the same source of iron again and again. So this is about the dry fruits that you can use for boosting the hemoglobin levels in your diet. Now, these, as I told you about the manuka or the munakkas, if you are really anemic, if your hemoglobin levels are really less, you can have about 20 pieces. You have to just drop them. In that case, you can drop them in hot milk and soak them in hot milk for half an hour, and then you can eat those along with milk, and that will really boost your hemoglobin levels. So this is regarding the dry fruits that you can use during the pregnancy, and they are delicious also, so there is no harm in eating them. I mean, you will also enjoy eating them, and you are not just eating for the hemoglobin. So it is also required during the pregnancy to be happy, and what you are eating, you should be enjoying it. So that is how these raisins are very important. Now, after that, I will talk about certain millets which you must have during the pregnancy. Now, the first millet that I will talk about is finger millet, which is nothing but nachani, or what is called as ragi in Hindi. Now, what is so special about this ragi? Do you know that in Ramayana, there is one story which says that Hanuman or Maruti, which is supposed to be a god of health or god of, जिसको बोलते हैं कि बहुत उनके पास बल होता है, strength होता है, power होती है, so that is Hanuman, and his favorite food is nothing but ragi. And the name also Ragi is given by Prabhu Shri Ram from Raghuvanshi. So R-A-G. So Shri Ram has given the name R-A-G-I, that is Raghukulotpanna Ragi. So that is the story. But besides that, nowadays, nutritional qualities of Ragi are very well known. Ragi contains, I should ask, what are the things that Ragi doesn't contain? It contains everything. It has carbohydrates. As sir was saying that they should be given one bar which is complete. I was just thinking of this Ragi, and we had also carried out one such experiment in our as Professor Dr. Nagarkatti has said that we are farming near Mumbai. So we had been providing the children over there with Ragi Kheer. And I want to share with you that all those kids are now Kuposhan Mukta. The complete village where we are staying, where we go often, and we give a Ragi Kheer on daily basis. I'm happy to say that the kids are actually Kuposhan Mukta. We also give this Ragi Kheer to pregnant women over there. So we are doing a bit over there. But this Ragi is very important because it is providing us with carbohydrates. It gives us proteins. It contains B1, B2, BC, B3, and most importantly, it contains a lot of iron, and it also contains a lot of calcium and other trace minerals also. It also has fiber, and therefore there will not be a problem of constipation also. So Ragi is one of the most important millet that must be given to pregnant women. They should be using it in the form of Ragi Sattva or Ragi Laddu, Ragi Dosa. So many cuisines can be prepared from Ragi, and then we can have actually good dose of iron from this Ragi. So do include Ragi in the diet of pregnant women in any form. The best thing I will tell is make Ragi ka laddu. As sir has suggested, you can add so many things to that Ragi ka laddu, like dry fruits you can add, khobra, that is coconut, dry coconut you can add, and then you fortify actually the iron which is present in the Ragi and make available to the pregnant woman. I always tell whenever I go for the lectures, I ask the women to carry Ragi laddu in their tiffin. Wherever they go, they can easily eat it and complete their they can have their appetite also full, and then they get enough of iron and other nutrients also. The another millet that I would recommend is pearl millet, or what is called as bajra. Now, what is this bajra? Bajra, we normally utilize bajra in winter season in the form of bhakri, in the form of rotla. And we also make laddus out of these bajra. You have to make the flour of that and make laddus out of bajra. The bajra, what is the speciality of bajra? Bajra contains a lot of iron, no doubt about it. In addition, it will be containing zinc. It contains zinc also, and it contains a lot of folic acid also. So actually, doctors are recommending iron tablets and folic acid as supplements. So this bajra as a food is containing iron and folic acid. So this can be a main paper to which the supplement will be the iron and folic acid tablets. That is what I always feel. So this bajra is very important. And one important thing I will like to tell here is what happens is these millets are drying. That is, they provide dryness to the body, to the skin, to hair. They have that particular chemistry. And therefore, what you must add to bajra. Whenever you are eating bajra, whenever you are eating ragi, there should be sufficient amount of fat also. And what is the fat that you must use here is you can have white butter, and the white butter is containing Wilson factor. White butter is containing vitamin D, as well as you can add ghee, which is highly beneficial. So along with millets, you must have good quality fat like ghee, or you can have white butter, and then sometimes you can also have dry coconut. So millets that you must use during the pregnancy are ragi, that is pearl millet or nachani, and ragi is finger millet, and then bajra pearl millet, that also you must use. So if you use these two millets twice a week, that is 4 times a week, I think that will be sufficient. Then I will tell you about some pulses which are very important from, again, the iron point of view. Now, what are these pulses? Now, the one most important and which is now not much in use is horse gram, that is kulit. I will show you this kulit. The kulit which comes, it is like dark brown in color. I don't know if you can see or not. I am trying to show you this kulit, and this is high. It contains so much of iron. You can boil it, you can cook it for a long time in pressure cooker by adding sufficient amount of water, and then just look at the color of the water that you are getting above it. It will be such dark brown color liquid, and we people convert it into kadhi by adding dahi or chas to it, and that is really very light as well as very high in iron as well as other micronutrients. So this kulit is one of the most important pulses that you should be using during the pregnancy. Now, the one thing I would like to tell you is there are so many pulses. Actually, it was an international year of pulses 3 years back, and it was found out that there are 65,000 varieties of pulses. It is, you may feel that it is unbelievable, but it is a fact that there are 65,000 different amount of different pulses, varieties of pulses, and we hardly use 10 to 15. So what we must do is try different pulses, because from different pulses we will be getting different amino acids, and that is how we will be getting complete amino acid profile. And therefore it is very important to include variety of pulses. Of course, kulit is the main thing, and the another one is moog. That is, I think everyone knows, and moog is very important because it is full with nutrients. Still, it is the most light on your stomach. You can easily digest it. You have to sprout it, and because of the sprouting, what will happen is there will be boosting of vitamins. That is, the quantity of vitamins will increase. B vitamin, C vitamin, even fiber, it increases when we are sprouting it. And after sprouting, what you can do is just add the spices of your choice, or you can add curds to it. You can just give tadka to it and eat it. And it is one of the most, and the name itself is mudga, that is, it is joy, it is giving joy. And therefore this moog is also one of the most important pulses that should be used in pregnancy, because it is light on stomach. Women can easily digest it also, because see, there are certain pulses which are containing high amount of iron, say like rajma or red chana. But what is the problem with them? The problem is with them is they are heavy on stomach. Sometimes you get bloating or gas, acidity. These problems may arise due to other pulses which are also rich in iron. So you have to see that what suits you. But these two pulses will surely suit everyone, which is kulit and mook, and the other pulses that you must use at least sometimes, they are rajma, then red chana. You can use besan also, which is the flour of this red chana or harbara dal, and that is also very useful. So like this, you can use different pulses for hemoglobin levels. Now I will talk about some vegetables. And what are the vegetables which are rich in iron? All of us have learned that palak is the one vegetable which contains large amount of iron. But I want to tell you one thing, that you must eat variety of grains. Don't eat daily just palak, because what you have to remember is every vegetable is unique, and you must see that whether it is in the season or not, then only you can consume it. For example, right now winter is starting, so you will get palak, you will get methi. But suppose that it is the rainy season. In rainy season, you will not get palak, you will not get methi. But somehow people try to obtain these vegetables. But what happens during a rainy season? The growth of microorganisms is more in rainy season, and therefore they are not good at that season to eat. But in that season, what we must eat is, there are so many green vegetables which are called as wild vegetables. That is, we are not sowing them, they just come like that only from the soil. And these vegetables, they are called as NUS, that is neglected and underutilized species. So these neglected and underutilized species, which you will get anywhere, if you go to a market which is quite big, or if you go to any suppose village, you can get all these vegetables. And these vegetables you get normally also in the market. Few women bring them from their village to the cities, and you try and include these vegetables in the diet, because there is no point in eating just one vegetable which is giving you just one kind of micronutrients, one particular set of micronutrients. But when you are eating diverse vegetables, diversity is the key. Because when you are keeping diverse eating, it may be in pulses, it may be in millets, it may be in vegetables, what will happen is you will be getting large number of micronutrients. Now this nutrition science is relatively new, and therefore maybe there are some micronutrients which are not yet known also to us. But yet, if you eat all those vegetables, they will be very useful for you. And therefore, the use of these green vegetables is very important. The curry leaves, which are very common, and daily we are using them. But how are we using these curry leaves? Are we removing them from our poha or from our sambar or from our curry? Then what is the use of those curry leaves? So what we have to do is, we should add these curry leaves when the dal or the pulses are getting cooked. So when they are getting cooked, if you add those curry leaves, then of course some of the nutrients of the curry leaves will be added to that cooked pulses, cooked dals, and then you will get the advantage or benefits of adding curry leaves. So another thing that whoever is cooking must do, you should cut the curry leaves such fine that no one should be able to remove it. So that is one good idea that I apply in my kitchen. So no one is able to remove the curry leaves, and automatically everyone is getting the benefit of iron or benefit of hemoglobin boosting for your body. The third way that you can use curry leaves is you can make chutney out of curry leaves. You can add, so for particularly pregnant women, what I will advise is you take curry leaves, roast them in oil, but roast till the green color remains. It should not turn into black color. Then the micronutrients get lost during that process. So just heat till it remains green but becomes thoda kurkura, nice, crispy. And then take chana, roasted chana, take till or sesame seeds, and then add uh, ginger, not ginger, you can add garlic or jeera and namak, and then grind it in the mixer, and you will get nice chutney which you can use daily, morning, evening, with your rice, with your roti, with your idli, whatever. You can put it in your sandwich also. So like that, if you can use the green vegetables in number of ways. Now, that is what I'm saying, that don't take shots, because nowadays there is a fashion that many people, they get up in the morning and then take, say, moringa shot. So that moringa powder, which is a very commonly used, we are using drumsticks in our kitchen. We are making sambar, we are making sabji out of it, we are making soup out of it. Then why we need moringa powder? Because when you are adding such single nutrient to water and heat, it will not be assimilated in the body. So it is not about, see, always what we say is you are what you eat. But I will say you are what you digest and assimilate. Just eating is not sufficient. It should get assimilated in the body. So if you are having just moringa powder with hot water, it is not going to get assimilated in the body, though you may be on high that I'm having moringa powder daily and spending a lot of money. So again, there is this one misconception that when you are spending more, then you are having more of nutrition, but it is not that. The reality is you have to eat local foods. If locally whatever you are getting you eat, then only you are getting the full nutrition out of anything that is, it may be pulses, it may be vegetable, it may be fruit. You will get full nutrition only when you are eating local and seasonal. Now there is a fashion that apple a day keeps your doctor away, but I should not say here all of your doctors, so you may get offended. We don't want to keep our doctors away, so we should be friendly with our doctors. But what we should do for this proverb, because that is the Western thing, so we must say that local food, local fruit per day will keep us healthy. That should be our motto, and not just apple, because if the apples are coming from California, then there will be lot of distance that the apples are traveling. So there is one more rule in the nutrition science which says that what is the farm to plate distance. If the farm to plate distance is less, then all the nutrients are retained. And therefore, if the apples are coming from California, if the kiwis are coming from, say, Australia, if the olive oil is coming from distant, then it is of no use for us, because the food has traveled a long distance, and in that long distance, the nutrients are lost. So that is one thing that everyone should remember, that whatever is local fruit, pregnant woman must have one local fruit, of course, per day, for the supplementary vitamins as well as the other minerals also. Because see, when we are talking about anemia mukta Bharat or anemia mukta pregnancy, iron will be assimilated only in the presence of vitamin C. So from where you will get vitamin C? We are getting amla now. amla is available right now, and amla is the one fruit which you can have anytime. I mean, if you dry it, if you cook it, its nutritional value doesn't change. That, I mean, the vitamin C doesn't get uh, less. That is, it remains intact, and therefore you can use amla. Whenever I'm saying the seasonal fruit, amla is the exception. You can make amla murabba, you can make amla achar and use it for the whole year. It will be giving you, and therefore Chawanprash is also very famous. So Chawanprash is containing vitamin C. So if you are having all those iron, whatever I have mentioned up till now, regarding the dry fruits and pulses and cereals and greens, along with that, you must have some vitamin C like amla, or you can have sometimes nimbu or orange, or most importantly, gava or peru. All these are very good sources of vitamin C. And if you are having this vitamin C along with all these iron sources, whatever I have mentioned, I think that hemoglobin levels will boost. Now, what about the people who moringa also is one of the best source, and then beetroot also. But I will like to tell you that beetroot is not that iron rich, but beet leaves must be used. Moringa leaves must be used. Now, how you can use moringa leaves, how you can use beet leaves, that you can add to your atta, you can add it to your curries. That is, you have to think over it, how your family will like it. But you must use these moringa leaves and beet leaves for iron. And then for non-vegetarians, they should have paya soup or nalli nihari. That is, those are the best sources of iron for non-vegetarians. So they can also enjoy these foods. And I think that is what I want to tell you. And one more thing, which is again very important, and pregnant women can use, is the gur or jaggery. Jaggery also is a rich source of iron. It contains a lot of iron. But how the color of the iron should be? It should be like this: dark brown or red color, and not the yellow one. When you see yellow color jaggery, you may get tempted to buy it just by the color. But now we know that black lives also matter. So black things also matter. And this is really very rich in iron. And when it is brown and red, then only it will be containing large amount of iron. And then you can use it, but don't use yellow colored iron. So this is about the jaggery that you can add. And daily, whenever you are eating bajra ka roti, add ghee on it, take jaggery on it, and have a nice meal. Along with it, you can have some green vegetable. So this will be a complete meal of iron along with other micronutrients, vitamins also. And I think this is all that I want to say. I can go on endlessly, but the time is the limit. So I hope that all of you like this part of how to boost hemoglobin levels. And thank you very much for inviting me here. It's a pleasure to listen to you. I was present from 5 p.m. onwards to listen to all the dignitaries. Thank you very much, Dr. Komal, Dr. Rajendra, and all the FOGSI committee. Thanks once again.
Thank you, madam. Dr. Pawan, sir, would you like to?
Yes, I would like to summarize the things. Madam has voted against the non-sticks which we are using these days. She has stressed on the cast iron, old iron, tawas and iron vessels. I think they were very useful. Our mothers and grandmothers were the hot favorites of it. And dry fruits, really are very good for pregnant. Black resins I always recommend. Lumps I always recommend. And in Gujarat, we are very fond of taking this laddus, ragi kheer, dry coconut, and pearl millet. But these are mostly taken by the patients after delivery. And she has recommended to take it before, pregnancy as well as during pregnancy, so that we can correct the anemia of pregnant as well as pre-pregnant patients. She has really stressed on amla and jaggery, and I'm sure that whatever she has narrated pulses, and I think Dr. Komal, you have done a good job, and from next conference or live workshop you should invite Sanjeev Kapoor also, because madam has given many preparations which he can serve in a better way on a better kadai of iron. And I'm happy to know that our Prime Minister Modi ji is also taking bakris of moringa leaves as well as beet leaves. And I really like the beet leaves parathas in our house, being a North Indian. And all in all, she has stressed the food. Really, madam, you have proved that how the nutrition can be a very important part of all pregnant, non-pregnant, and pre-pregnant patients. And thank you for your organic chemistry being used at this age by all the doctors also, and good suggestions given by you. I again thank Dr. Komal for inviting me for this compilation of how the nutrition can be an important part in our thali. Thank you so much.
I would like to add one thing, Komal. Can I add?
Yes, madam.
Doctor just said that after delivery, normally these foods are recommended. But after delivery, I recommend mostly halim or aliv, which we should not consume during the pregnancy. But otherwise, all these foods, they can be consumed. But not aliv ka laddu or gond ka laddu. They should be consumed after delivery. So olive is also a very good source of iron. However, we cannot use during the pregnancy. Once in a while you can eat, but not often.
Thank you, madam, for this wonderful talk. I just wanted to ask one question. What about beetroot juice? Many patients come and tell us that they are having beetroot juice and carrot juice daily. It is a little, I mean, the garam karte martat na, it increases your power. So is recommended in pregnancy?
Actually, juices are not recommended till you are having teeth. If you have teeth, you should not have juice. Okay. And I told about moringa also, moringa powder, because people think that by taking just one particular food item in isolation, it is going to help them. But foods don't work in that way. That superfood, the definition is only that it acts along with, it's like a group. Now all of you are working together to make Anemia Mukta Bharat. So similarly, all these foods will come together to give iron to our body, and not just one particular food will be helpful. So no shots, no smoothies, no powders. Eat traditionally. That is the most important thing.
Thank you.
Thank you so much, Professor Rekha Divekar. It was real enlightening talk, and so many tips you have given regarding the diet, which is the most important constituent. And
thank you.
Madam is the one inspiration from whom our renowned celebrity nutritionist Rujuta has taken, and she has done wonders. Being mother to her, you are like a mother to all the pregnant ladies,
thank you.
and always guiding them regarding the nutritional issues. And thank you very much, madam, for being as a guest speaker for today. And we would like to hand over a digital plaque to you. So the team, please show the digital plaque for Rekha madam. Please accept this on behalf of FOGSI.
Yes, thank you.
Valuable time and giving so many important tips regarding nutrition. Thank you very much, madam. And we would also like to hand over a digital plaque to our chairpersons who have beautifully conducted the session, Dr. Nagargatti, who is the chairperson of FOGSI Midlife Management Committee, and Dr. Pavandir, who is a very senior gynecologist and has made a session very interesting. So this interesting session was also viewed not only on the TOG link, TOG Science Integra, who are our official screening partners, but also on the IMUMS app. It is the app used by almost 85,000 pregnant women all over India. And they have been seeing, and those all women have taken the tips from you, madam, and it was screened all over on Facebook and on M3 Media. And I would like to thank our partners for today, the MCure Pharma, for being the full support in this campaign, and they have been always helping us right from the inception till this program. And thanks to all the TOG team, Science Integra, M3, IMUMS, and MCure for making this happen. And without any delay now, I would hand over to Dr. Saijas, who would do the taking forward of the further proceedings. Dr. Saijas?
Yeah. Thank you so much, Komal Madam, for this opportunity to be one of the coordinators for this wonderful program in which we are on a journey to achieve an anemia-free pregnancy around the country and maybe all around the world. It's my privilege to invite the chairperson for the next session, and that is none other than Dr. Niranjan Chavan. Yeah, it's wonderful opportunity to probably be able to do the honors of introducing a person who hardly requires any introduction in the FOGSI circles. Sir is a professor and the unit chief at LTMMC and LTMGH Sion Hospital, which you all know. As I always believe that when you talk from the heart, and the first thing that comes to my mind when I talk about this particular person is the tremendous COVID work that Sion Hospital has undertaken, and he was in news for all the good reasons. So much more than all the wonderful posts and the official positions that he has held, I think he deserves a big round of applause for leading this team at Sion Hospital in the COVID work. Is the joint treasurer-elect between 2021 and 24 of FOGSI, which he'll be taking up soon, is a national coordinator of the FOGSI Medical Disorders in Pregnancy Committee. And I do understand that this couple has been doing tremendous amount of work in this field, educating the gynecologists around the country on this particular topic of medical disorders in pregnancy. He has been the chairperson of the FOGSI Oncology and the TT Committee between 2012 and 14. He was the vice president. He is the vice president of MOX 2020-21, scientific secretary of AFG, chair and convener of the FOGSI Cell Violence Against Doctors, dean and the chief content director, high grade E3, chief editor AFG Times 2015-16, and very, very importantly, a wonderful, wonderful individual, a very active person in FOGSI circles. So let me hand it over, let me welcome Dr. Niranjan Chavan, sir, and hand it over to my dear friend, co-coordinator, Dr. Priyanku Roy, to take over the session from here.
Thank you so much. But before we start the wonderful presentations of the skit, judging by the FOGSI luminaries, the past presidents, and really a lot of efforts have been done by all the coordinators. And I would like to thank now, as I have been here since 4:30 p.m. A lot of wonderful things have just happened, especially the panel discussion where there were government and the media, and there were from neonatology, from physicians, from PSM department, and from the Ministry of Health. And I would like to thank Hema Divakar. Of course, I would like to thank all the panelists who participated into this program. And really, it was an honor to hear from Alpesh Gandhi sir and the FOGSI office bearers, Dr. Atul Ganatra, Rishikesh Pai, Madhuri Patel, all of them joined today. Coincidentally, it is the birthday of my late mother, Dr. Nalini Tai Chavan, who contributed 75 years of her life, out of which 40 years in treating women of, lower socioeconomic conditions. She was also a gynecologist, and I'm very happy she's today looking up from to all of us and thanking, I thank her for all the guidance which she has done. Without much of taking all of your time, wonderful lecture by Rekha. I would like to thank and congratulate Dr. Komal. She is a wonderful person and really she has roped in all the coordinators and you guys have done a wonderful job. So it's your turn now. The finale, the grand finale, so many societies have contributed to the slogan, to the skits, to the rangolis, to the community activity, and it's a culmination of 3 weeks. And I'm just going to be here to be there and see all of you having a good time. Thank you so much. But before I go, I would also like to thank the media partners, M3 India, TOG Webinar, Science Integra, and last but not the least, the whole team, FOGSI Medical Disorders. More than 40 members of you have been there coordinating, and also Emcure Pharmaceuticals to make this event happen. I hand over the mic now to Dr. Shaijush and Priyanku.
Yeah, thank you, being a national coordinator, for giving us this opportunity for coordinating this wonderful session of Anemia Mukt Bharat. So to a prize of the poster competition that we had, it was a wonderful competition with a lot of colorful posters that were being sent to us. So I would invite the judge for the poster competition, Dr. Professor Krishnendra Gupta, sir, who's the professor and unit head. Can I have the CV slide, please, support team? Yeah, professor and head, Vivekananda Institute of Medical Sciences, Kolkata. Sir is, he was the president of the Bengal Obstetric Society, past vice president of the FOGSI. He is currently, he was the chairman of the Reproductive Endocrinology Committee. He is currently the FOGSI representative to AOFOG, and overall a very guiding fatherly figure. Whenever we have these meetings in West Bengal of any obstetric Bengal Obstetric Society, he always is there to guide you as a fatherly figure. So I welcome you, sir, to this platform, and I hand it over to you to announce the prizes after the excellent effort that you have put in selecting them and judging the prizes, sir. So I hand over to you, sir. Krishnendra, sir.
Thank you very much, Priyankur and Shaijus, and of course, hearty congratulations to Komal, Niranjan, and the entire team of the Medical Disorders Committee of FOGSI for this wonderful kind of event. And I think we had a brilliant panel and excellent presentations by our respected speakers. And I must thank Professor Naren and Professor PK Shah for allowing me to go first, because I actually had another Zoom meeting at 7:30. I just mentioned to them that I'll be joining a little late, but thank you for this, for allowing me to speak before you. And my snippets is going to be a snip, because I'm not going to say anything about anemia, because enough has been said. We just go straight ahead. We had fantastic posters. I think I always say that anyone who participates are winners, and we have the posters. We had 34 posters actually, and the third prize of the poster goes to Dr. Shrutika Dakar from the Mumbai Obs and Gynae Society. Hearty congratulations to her, and it was a really good. The second one goes to Dr. Shushmita Srivastava from Bhopal. Congratulations to her too. And the first prize goes to Dr. Archana Singh from Haldwani, who I think stood out with her presentation. I loved her theme, "Don't take anemia so light, safe pregnancy is your right." I think that was a very, very catchy tune and catchy theme, catchy punchline. And I think that's what stole the prize. So hearty congratulations to everybody. And I thank Dr. Komal and the entire team at the Medical Disorders again for giving me this opportunity, and thank all my seniors for allowing me to go before them. And to everyone, stay safe. God bless you. Thank you very much.
Thank you, Krishnendu, for your efforts. We would like to hand over a digital plaque to you, and please accept it in this COVID times. I'm sure we would have met in person and handed over to you, but it will join you soon on email.
But frankly, I don't think I met you so often, Niranjan, that I'm meeting you virtually than in physical, actually.
Yeah. So thank you, Krishnendu, for giving your valuable time, and I thank all the judges to allow you to
so
be
much
there.
for this opportunity.
On behalf of all the team, we would like to thank you. Thank you so much.
Thank you.
Thank you so much, Krishnendu sir.
Thank you, Krishnendu sir, for judging the posters.
Priyanku.
Now I would like to hand over the session back to Dr. Saijas to welcome our next judge for announcing the next prize. So Saijas, over to you.
Yeah. It was another privilege to coordinate the skit event, skit bar the video entry towards achieving an anemia-free pregnancy. And as a judge, we had a wonderful, wonderful person, a very, very creative individual who infuses life every moment he lives. I think you just need to keep watching him on Facebook, and you can understand the positive vibes that he can spread every moment. But not just him, I think it probably the entire family does that job, including the little ones at home. Can I have the CV slide of Enam sir? Yeah, again, a person who hardly requires an introduction in this circle is a professor of the Dubrovnik International University. I'm not sure, sir. Very sorry that I'm pronouncing it right or not. The Sarajevo School of Science and Technology. Is basically the vice president of the World Association of Prenatal Medicine, the past president of ISPAT, the past president of ISAR, the vice president of CEFOG. We all know him as has been an enterprising president of FOGSI between 2008 and 9, the dean of ICMU, the director of Ian Donald School of Ultrasound, and the N number of programs that he has conducted, the organizational skills that this wonderful person possesses. And as I told, much more than anything, I think you just have to meet him. Just look at his picture and you can start feeling the positive vibes about this wonderful individual. So that's from my heart. Over to you, Narendra Malhotra sir, for taking us through the journey of judging those probably wonderful skit entries towards achieving an anemia-free pregnancy. Over to you, sir.
So a very good evening to all of you. It was indeed a pleasure to judge these skits. The most difficult job I've ever had in my life, ever. So I had to go through each and every skit 3 times to just give them marks. And if you note, the marks are 82, 83, 84, 85, 86, 87, 88. It's just one mark, probably difference of all of them. Fantastic. These doctors have so much talent that probably we should
before
have...
you announce, before you announce, you have a sir. Before you announce, you have to present the snippet, sir, of the myths and beliefs.
Yeah, I know that.
Yes.
So that's what it is here. So I was saying that there is a Hollywood, there is a Bollywood, that has to be a Foxywood now for these doctors who are great actors, great talent, great singing, great acting, and great direction. So I was after this fantastic anemia conclave, which I kept hopping in and out, because today has been a record day for me. 4 lectures since 2:30 p.m. and 2 with Niranjan only. So
thank you, sir.
In the afternoon. So it's been a crazy academic day. Thank God no deliveries came today. Only
lucky. We are lucky, sir.
And assistants and Niharika are handling those. So I was told to talk a little bit about myths, knowledge, and attitudes for anemia. Now in India, everything is surrounded by myths. Everything is surrounded by lack of knowledge, and everything is surrounded by the wrong attitude. So we believe in all the wrong things. We have no proper knowledge because it's very easy to give advice. It comes free, and everyone gives advice on everything. We even give advice on verbal, on watching TV, on how Sachin Tendulkar should have hit that ball. And even when we have never held a bat ourselves. So ye to udhar 6 marna tha, ye to idhar square cut marna tha. So that's what India is. Well, there is a lack of knowledge. There is a lack of knowing about iron-rich foods, which we heard. There is a lack of knowledge on what iron supplement to take. Black tablets, I just heard in one of the skits, you take black tablets, the sun will come as black. And see, it is always in those skits mentioned sun. Only 2 skits said daughter or child. So that sun attitude has to go out. That's in 2008 when I gave the slogan Beti Bachao, Beti Padhao. And we changed the slogan in 2018 to Beti Bachao, Beta Samjhao. So that is. Then we have no idea, Indians have no idea about the hemoglobin levels. So when we get a hemoglobin level of a doctors in a medical college, we did a survey, 80% had less than 10. 80% of gynecologists have a hemoglobin less than 10. That's the country we are living in. Fantastic talk, which we heard, wild vegetables in monsoon time. Good iron-rich, expensive foods are not iron-rich. It is the local food and the agri and simple foods which thing. So that's what I believe. Our duty today is to provide awareness about anemia still. And we, in 2008, FOGSI gave the slogan 24/7 with MCure only, Mr. Khanna at the head, 24/7 anemia hatao. And then it went to 12 by 12, the age of 12, hemoglobin 12 in the same year. And today we have Anemia Mukt Bharat. So anemia, whatever slogan we give, our sole aim is to remove anemia. And as you heard Jaideep Tang, the comorbidities with anemia, the indirect cause of mortality is much more than direct cause. And we somehow have to get this anemia out of our country. Even by SDG 2030, if we can get the anemia reduced by 30%, we will be a very, very healthy country. So that's all I have to say today. Coming to the skits. Position 3 was a tie. And let's see position 3. There were 2 skits from Jabalpur, the Jabalpur Medical College and the Jabalpur Society. And Jabalpur Society has tied with Amravati Society for the 3rd position. And they could have been first also. The first one just had a one mark edge. So Amravati and Jabalpur Society, not the medical college.
डॉक्टर को दिखा, अपनी शीतल मैडम को दिखा देना।
अरे माँ जी, कैसे आना हुआ?
अरे इसको लेके आए ना, इसकी तबीयत ठीक नहीं है।
हाँ, क्या हो रहा है?
बहुत थकान से हो रही है।
That's a natural acting. Nobody is looking to the camera. Nobody is
बहुत सफेद दिख रही है। ऐसे में पीरियड्स में बहुत खून ज्यादा जाता है क्या?
हाँ, थोड़ा सा ज्यादा है।
Asking the right questions to an adolescent girl.
वो करके मुझे दिखा देना। हाँ? अरे मिल गए क्या रिपोर्ट्स? अरे बाप रे, इसमें तो 7 ग्राम खून निकला है। मैं ना आपको लोहा सत्व की गोलियां लिख के देती हूँ। ये खाना नहीं खाती क्या बराबर से?
नहीं, ये खाना नहीं, पिज्जा और बर्गर खाती है बस।
अरे बाप रे बिटिया, ऐसा तो बिल्कुल भी नहीं करना। जंक फूड खराब है। खाने में हमेशा
Great message on junk food. Great message on junk food. So it qualifies for the message also.
मूंगफली के लड्डू इसका समावेश रहना चाहिए। और अगर नॉनवेज खाते हैं
Local foods, मूंगफली and गुड़.
और एक चीज याद रखना, अगर
non-vegetarian food, I mean that is a debate always.
होगा तो तुरंत डॉक्टर की सलाह लेना जरूरी है और हर 6 महीने में जंक की गोली भी लेना जरूरी है। तो याद रखो, कसरत और समतोल आहार बता दे एनीमिया को पार।
Jabalpur, both your presentations from the Jabalpur Medical College and the society were excellent.
अरे
Again,
सुनते हो,
Jabalpur society
मेरा प्रेगनेंसी टेस्ट
better.
पॉजिटिव आ गया है।
अरे वाह,
क्या बात है। पर हम पिछली
Congratulations,
बार
madam.
वाली कोई
Pregnancy
गलती
test के
नहीं
लिए.
दोहराएंगे।
पिछली बार तो
डॉक्टर साहिबा, मुझे घबराहट हो रही है। मेरी सांस भी फूल रही है और कल से बच्चा भी नहीं घूम रहा है। मैडम।
खून की लगातार कमी के चलते सुमन का बीपी बहुत बढ़ गया है और बच्चा पेट में ही खत्म हो गया। अभी डिलीवरी में भी अधिक खून जा रहा है। उसकी जान को लगातार खतरा बना हुआ है। ये सब बातें मैं आपको इसीलिए समझा रही हूँ कि आपको पता चलना चाहिए कि खून की कमी से कितने नुकसान हो सकते हैं।
हाँ,
Awareness.
इस बार तो
Awareness
मैंने
message. Very great.
डॉक्टर साहिबा के अनुकूल 6 महीने पहले से ही फॉलिक एसिड शुरू कर दी है और अभी जब मेरा यूपीटी पॉजिटिव आया है तो हम कल का ही अपॉइंटमेंट लेकर डॉक्टर साहिबा से मिल लेते हैं।
कल क्यों?
It's not
आज
only
ही
iron
चलते
which
हैं।
is
वेरी
responsible,
गुड।
it's folic
इस
acid
बार
also.
सुमन का एचबी था हमेशा 12, इसीलिए तो स्वस्थ माँ और स्वस्थ बच्चा।
अनीमिया को है हराना।
जागो, अगर हीमोग्लोबिन हो 8, 9, 10 या 11।
गाजर, चुकंदर, गुड़, चना, पालक
रोजाना हो खाने में।
हरी सब्जियां बनाओ
लोहे के कढ़ाई में।
हर माह जांच कराना
Local
है।
foods.
आयरन की
Cooked in
गोलियां
local
नियमित खाना
utensils.
है।
फिर भी चक्कर, घबराहट, थकान हो
तो सचेत हो
All
जाना।
the symptoms
न
so
बढ़े
beautifully
बच्चे
shown.
का वजन।
IUGR या आए सूजन।
हाँ, डरो, ये है अनीमिया के कॉम्प्लिकेशन।
और दिखाओ डॉक्टर को,
तभी मिलेगा सॉल्यूशन।
याद रहे हीमोग्लोबिन सही सिर्फ 12 है।
Very, very nice. Very, very nice. Again, very. And look at this one. Greater Noida Society, a new society.
कीमत तुम क्या जानो रमेश बाबू? अरे इतने बन के कहाँ चले? जीजी अस्पताल
Look at the acting. Fantastic. And the direction.
जाके अस्पताल में हर बार दिखाना चाहिए। लो कर लो बात। आजकल की इन बहुओं को तो बाहर जाने के बहाने चाहिए। पति संग सिनेमा जाएंगी, रहो चुपचाप यहाँ और एक मसाला चाय बना के लाओ मेरे लिए। जी माँ जी, मेरे हाथ पैरों में सूजन आ रही है, बहुत थकान भी महसूस होती है। जरा सा भी मैं काम
Daughter-in-law, mother-in-law relationships.
इनके साथ आज मैं अस्पताल में आऊँ क्या? लो कर लो बात। तू अकेली ना है जो बच्चा पैदा कर रही है। मैंने तो 6 कर लिए, कभी ना गई है।
Lack of awareness.
ये ताली गोलियां जो तू हर समय ताली लगती रहती है, गोली खा लूं क्या? काम न करने के बस 100 बहाने हैं तेरे पे।
बावड़ी हो गई है क्या तू? ये गोली नहीं खानी है, इससे बच्चे काले होएंगे।
The myth, the myth.
एक बात कहना है, डिलीवरी के दौरान उसको खून इतना ज्यादा गया है कि हम चच्चा को बचा नहीं। आपने एक बात समझी नहीं, पूरे 9 महीने उसको कहीं भी नहीं दिखाया। जब वो आई थी हमारे पास, इस स्थिति में आप लेके आए हो, उसके अंदर तो खून था ही नहीं। इतनी ज्यादा एनीमिया था उसको। और आपको पता है उसके जुड़वा बच्चे थे। वो तो यहाँ आके टेबल पे जब एग्जामिन किया तब पता चला जुड़वा बच्चे हैं। उस स्थिति में मरीज को खून की और ज्यादा आवश्यकता होती है। उसको
No antenatal care. And no supplementation, no nothing. And a very, very tragic end which the anemia has caused.
आयरन की गोली नियमित रूप से लेने पर जच्चा और बच्चा खून की कमी और इससे होने वाले खतरे से बच सकते हैं।
अनीमिया मुक्त भारत।
Congratulations, Naima Afreen, for directing it so well and giving that message so well. You are great. And this society, I have no words on their creativeness and the directional skill. So, absolutely what expressions and what fantastic way they have put it forward. The baby born too
are you
early,
sleeping in the class?
prematurity,
Haven't you solved this problem yet?
children not
What
attentive
is
in
wrong
the
with
class,
you?
so they've addressed everything, every age.
What is wrong with me?
Underperformance, pregnant mothers,
Have you taken your
nightmares.
iron tablets? But I found these tablets in the dustbin. Do you
Throwing the
realize
tablets in
if you don't take
dustbins,
these
not eating
tablets,
them.
you'll develop anemia? You could even end up in a premature birth. Your heart could fail and you may not be able to
Remembering
tolerate
what she
blood
was
loss.
told during
Your
pregnancy.
baby's growth could get stunted. Your baby's brain development too can get affected.
Addressing all aspects of pregnancy care. And the fantastic family relationship shown here. Local foods, iron-rich foods, served and eaten with pleasure, with a lot of love. That love and affection comes here. And we got to do that to women. You have to feed them the tablet. Don't let them. And a great message in the end. Fantastic Doctors of Kannur Society. Very well done, directed and written by Shaijas. Thank you very much. Congratulations.
Thank you, sir, for a wonderful judging this. It was really difficult and superb, excellent skits being done. Congratulations to all the participants who have taken a lot of efforts. As you said, sir, we are not less than Bollywood stars.
Not
And
less,
sir,
no way.
yes, sir, yes, sir. And
Look at
I
me. Look at
yes,
me.
sir. I was just going to compliment your quote. Since afternoon, I have seen it the way, sir. It is like Mohinder Amarnath. I can see, and the logo FOGSI where we got
This is
this
the FOGSI logo.
during
Thank
Madam.
you. Thank you,
Yes.
Dr. Nandita, for giving this to all of us during your presentation.
Thank you, and sir, it was great to have you. And on behalf of FOGSI Medical Disorders and Pregnancy, whole team, we would like to congratulate you and give you a digital plaque, and you will receive it in your email. We are very fortunate that in spite of your busy schedule, you were there today and you judged them right. Thank you so much, sir.
So, okay. Hello from the family.
Hi.
Arey wah.
Hi.
So happy to see.
Hi. Lovely event.
Thank
Yes, thank you very much.
Hello,
So
Dr.
nice to see
Jadip.
Madam.
Hi.
Hello, madam.
Hello too.
Okay, great.
Thank you, madam. Thank you, sir.
Thank you so much, sir.
Thank you. Now I hand over the mic to Dr. Charu Modi, madam.
Thank you so much, sir. It was really wonderful to watch all the skits and everything. It was really a pleasure and a treat to the eyes. Thank you so much. Now, I would like to thank Dr. Komal once again for giving me this wonderful opportunity to coordinate this entire Mammoth project. Indeed, a very big congratulations to you, Dr. Komal, and sir, to you too also. Now, I have been given this responsibility to introduce yet another powerful gravitational personality of today, who's none other than Dr. P.K. Shah sir, who actually indeed needs absolutely no introduction at all.
Just 2 lines. Two lines.
As rightly been said, he is the Bapu of FOGSI. Sir, just to formally introduce you, sir, sir is the past president FOGSI, past Vice Dean Indian College of Medical Ultrasound, past Vice President Senior Medical Teachers Association, past Dean Indian College of Medical Ultrasound, Joint Secretary IMA GES, Fellow WellStart International USA, FOGSI representative to AOFOG, past editor Journal of IFUMB, co-editor OBGYN Journal Today, member of Safe Motherhood Committee FIGO 2013 to 18 and USG Committee AOFOG 2013 to 17. Is the chairman Imaging Science Committee CEFOG 2017 to 2019. Such a towering personality, yet so humble, sir. With these words, may I now invite to say a few words, sir. Stage is all yours, sir.
Yeah.
Thank you.
Thank you, Charu, for your kind words.
Thank you, sir.
First of all, I would like to thank Dr. Alpesh Gandhi and all the office bearers of FOGSI, including Dr. Archana Verma and Dr. Atul, all the past presidents of FOGSI who attended today's webinar, Dr. Rajendra Nagarkatti, Dr. Pawan Dee, Dr. Niranjan Chauhan, all the representatives from UNICEF, NNF, NIH, FW, API, etc. My co-judges, Dr. Narendra Malhotra, Dr. Nandita Palshetkar, Dr. Ramani Devi, Dr. Krishnendu Gupta, and Dr. Sudhir Shah. And of course, not to forget the coordinators who have been coordinating as regards these awards. And I would like to take everybody's name, Dr. Surekha Taide, Dr. Shashibala Bhosle, Dr. Charu Modi, Dr. Aarti Luthra, Dr. Saijas Nair, Yogini Rolekar, Priyankur Roy, and Dr. Kanchan Prasad. Thank you very much for excellent work. And to add on all this, Dr. Komal Chauhan. the chairperson of Medical Disorders of Pregnancy Committee of FOGSI. I thank you, Komal, for inviting me to do this fantastic job of judging the slogans. But before that, she has told me to talk on or give a snippet on which iron to choose. What options do we have when it comes to iron? She told me that this program is going to be seen by non-medicos also. And I have a set of slides, but I'm not going to show you that. It's too late. And I will tell you in short that when you talk about options of iron, I'm talking about only iron therapy, not management of anemia. You have oral iron and you have parenteral iron. And lastly, you have blood in severe anemia cases. Oral iron, you have various salts available, ferrous sulfate, ferrous fumarate, ferrous gluconate, etc., etc. You can take one tablet twice a day. When you start with one tablet. After a week or so, you can start with 2 tablets, one tablet twice a day, so that your GI tract will not respond. You can have nausea, vomiting, diarrhea, constipation, and you may not be able to tolerate the iron. This happens to few patients who are pregnant. And in that case, we give them parenteral iron, either in the form of intramuscular or intravenous, depending on what is the hemoglobin, whether it is mild, moderate, or severe, and at what time of pregnancy she comes to us.
दौड़ के वो लेके आती के कान का टेरेस में लगा हुआ.
Can you stop these people talking in between? They are running a parallel summit, it seems. We can have, we all know about various iron dextran that we have used for so many years in past. And we have iron sucrose, which is available to us now. And then we have a latest intravenous preparation, FMC, yeah. And we can give all these things depending on what is the hemoglobin and at what stage of pregnancy she has come. If it is very severe anemia in later part of pregnancy, you cannot give iron, you have to give blood. And that's all I want to say, because it was a snippet. I thought 22 slides on choice of iron would be too much at this time of the day. Now coming to the result, Charu, you have the result. Can you show it?
May I ask Dr. Komal to coordinate, please?
Yes.
Komal?
Support, please show the results for the post, for the slogan. Sorry.
Slogans.
So again, we have a tie in the third prize.
I request the support to please mute the voice. Let sir speak.
Too much voice.
Yeah, just reduce the
Go
voice,
back.
sir.
Go
Yeah,
back
please
to
go
the
back,
first
sir.
slide.
Sir, the mic is yours, sir. Please go ahead.
I think the third prize, there is a tie. So 2 people get the third prize. One of them is Gurpreet Kaur Sandhu from Aurangabad, Maharashtra. And she has written very nicely in Hindi and Marathi, Har Hindustani Garbhavati ka hamesha ye rahe nara, hemoglobin hamara hamesha rahe 12. I think that is a good one. The next one, Naima Afreen was the director of one of the skits that Dr. Narendra Malhotra showed. She has got this slogan. I had no idea about she's getting one prize with the other judge. Har Nari Anemia Mukt, Bharat ki Pragati Adbhut. This is a word from Modi, I thought, like our Prime Minister Modi, something similar to what he has been talking. So I like this also. Okay, next. Dr. Sheetal Bodke from Nagpur. शरीर में सूजन, हल्के में थकान पचानो, गर्भवती में एनीमिया का है मुकाम. फल, हरी सब्जी और लोहयुक्त आहार दूर करे गर्भवती से एनीमिया का विकार. एंड 1 गोली आयन की जीवन का आधार गर्भवती के एनीमिया का यही सही उपचार. I thought she has covered all the symptoms and the treatment in such a beautiful way. So congratulations to both the third prize winner and second prize winner. And we come to the best slogan, though it is, if you see this slogan written, the way it is written, you won't like it, but नियमित जांच, आयन की दवाएं, संतुलित भोजन, यही है स्वस्थ गर्भावस्था का आयोजन. And that is from Kunjan Shah from Ahmedabad. He gets the first prize for this slogan. Congratulations to all four who have done this job. We had totally 68 entries, and it was very difficult to really pick up. I thought that we would give 2 more, but anyhow, with whatever we were given, that we had to give only 3 prizes, I could select these prizes. Thank you. Thank you, Niranjan, and thank you very much, Komal, for doing such a fantastic program. I enjoyed it thoroughly. I am here since almost 5 minutes to 5.
Yes.
I had joined, and
Yes,
I'm very
sir.
much here.
Sir, you are the teacher of teachers, and we are honored, sir, that you have spent so much time. I want to tell you, sir, that we had more than 90 slogans, and there was so much over enthusiasm that each society had, few of them had sent six slogans from different individuals. So literally we had to write them back and tell them that kindly send only 2 slogans, and that is how we could shortlist, sir. We are very sorry for the inconvenience caused, but I think, sir, you have taken a lot of efforts and pains, and the coordinators, especially Dr. Charu and Aarti, have done a
Aarti Luthra.
wonderful job. Yes, sir.
Aarti
Yes, sir.
Luthra.
Yes, yes,
Very
sir.
good
Thank
job.
you so much.
Thank you, sir.
Thank you. And Archana ji, thank you so much for guiding us. And we would like to congratulate you by giving a digital plaque. I request the support to please share. And on behalf of FOGSI Medical Disorders in Pregnancy, we honor Dr. P.K. Shah, signed by Dr. Alpesh Gandhi, Jaideep Tank, Secretary General, President, Alpesh Gandhi sir, and Atul Ganatra, Vice President, and Dr. Komal Chavan as a chairperson of the committee. Thank you so much for
Thank
being
you.
with
I
us, sir.
accept it most humbly. Thank you so much.
Thank you. Thank you, sir. Now I hand over the mic to the next coordinator. Please come over. Thank you, sir.
Kanchan.
Yeah, good evening, everyone. It's my proud privilege to introduce T. Ramani Devi ma'am, who is a cool and dynamic leader from South, from Trichy. And she will be going to announce the name of winners of iron-rich recipes. She doesn't need any introduction, but for the formality, she is a National Vice President FOGSI 2020 and International Advisory Board member of Fertility Society of Bangladesh. She is ICOG Governing Council member and Managing Director, Ramakrishna Medical Center, LLP and Janani Fertility Center. And she holds various posts and she has various awards and accolades to her credit. And so I offer you a warm welcome, ma'am. Ma'am, please come and say a few words about the effect of anemia on mother and baby. Welcome, ma'am.
Hi friends, this is Dr. T. Ramani Devi, Vice President of FOGSI 2020. I would like to share this message on the day of iron deficiency on November 26th. Regarding the anemia in pregnancy, nearly 70 to 80% of our pregnant women are anemic, whether it is rural area or it is urban area. The commonest cause for anemia in pregnancy is iron deficiency, followed by B12 deficiency, folic acid deficiency, and other types of hemolytic anemias and hemoglobinopathies. But the commonest is iron deficiency anemia. Let us talk something about this. During each pregnancy, women need around 1 gram of iron for the turnover of iron content during the pregnancy. One is women need to expand their blood volume as well as they need to supply the fetus and they need to supply the placenta. Altogether, you need to have increase of iron intake by 1 gram throughout pregnancy. Most of the women, they start their pregnancy with a negative balance. That means there is a lack of preconceptional counseling. So prior to pregnancy, it is always safe for the women to increase their hemoglobin to minimum of 12 grams percentage so that it will be of use during their antenatal period. Other cause for iron deficiency anemia could be due to worm infestation and due to proper lack of dietary intake of iron. So how to pick up this iron deficiency? Simple thing is you do a complete hemogram or a hemoglobin percentage. Whenever there is less than 11 grams of hemoglobin percentage during pregnancy, then we say that the girl is anemic. So, by simple clinical laboratory diagnosis as well as the clinical diagnosis of pallor in the women and extreme tiredness, we can pick up iron deficiency. Now let us see what happens if the woman is iron deficient. It has its impact upon the fetus as well as upon the mother. The fetus has increased incidence of miscarriage. Because of associated folic acid deficiency also, there can be increased chances of developing abnormal babies, and the babies' birth weights are low, what we call it as intrauterine growth retarded babies with a low birth weight, and they have higher incidence of failure to thrive, and when they are born with a deficiency of iron stores, which predisposes to early neonatal infections and infections throughout the first year of their life. Then coming to the impact upon the mother, the mother suffers from so many problems due to iron deficiency. The commonest one is extreme fatigability and failure to take up even the normal work. She is at a high risk of developing pregnancy-induced anemia. She can have anemia secondary to renal problems like renal insufficiency or recurrent urinary tract infection or hypothyroidism. So that has to be also parallelly checked when you come across a woman with iron deficiency. So also there is mother is at a high risk of developing morbidity and mortality. See, if we analyze the maternal deaths, 20% of the maternal deaths are primarily due to iron deficiency anemia, or 20% is due to the indirect cause of maternal mortality. So the woman, if she is basically anemic, she suffers with anemia with failure during pregnancy. She can go in for congestive cardiac failure, and during delivery, even a small amount of excess of vaginal bleeding, postpartum bleeding, could be detrimental to this particular woman, and they are at a high risk of developing postpartum hemorrhage, puerperal sepsis, as well as failure to lactate. Enough of lactation will not be there in these women who have iron deficiency anemia. So ultimately, it has got a negative impact upon the mother as well as upon the fetus. So once having diagnosed, it is always the duty of the obstetrician to convince the woman to take iron-rich dietary supplements and not to forget the oral iron of minimum of 100 tablets during the entire period of pregnancy, which is available free of cost in all government setups. If the woman is found to have a severe anemia, which is somewhat less than 7 grams hemoglobin percentage, maybe she is a candidate for intravenous iron preparation to be taken, as well as if the hemoglobin level is very, very low, severe anemia, maybe in such patients we need to transfuse them. So any woman entering pregnancy should be checked for anemia, and she should be corrected at the earliest possible time. Again, periodic, each trimester, the girl has to be checked for her hemoglobin and PCV and peripheral smear, and it has to be followed up, and iron supplementation along with folic acid and B12 has to be given. So on this World Iron Deficiency Day, I wish all our antenatal mothers could be pink with proper supplementation of iron so that they land up with a good feto-maternal outcome. Thank you for the opportunity.
Thank you, Dr. Ramani Devi, madam. Actually, madam has joined, but due to some technical issues, because she was on the way traveling, and then she's thought of sending a message. And now the announcing of the prizes, which Dr. Ramani Devi has done in coordination with Dr. Kanchan. May I have the slides? She has done the prizes for the iron-rich recipes, and it was a real great entry with a lot of skill shown by our FOGSI members, a lot of iron-rich food and so much iron. Now we have a recipe book we can write, but we have shortlisted few recipes, and the third prize goes to Dr. Chinki Tukral from Nabha Patiala, who has shown a platter of recipes, all of iron-rich. And these are the beautiful pictures. There is a recipe details also. We will be removing a small booklet and releasing on the behalf of the committee, so you can have the details of the recipe. So congratulations, Dr. Chinki Tukral from Nabha Patiala. The second prize.
Dr. Ramani madam has joined.
Joined, yes, wow. That's the dedication, madam. Welcome, madam. Madam, you do the honors, madam. We are starting with the third prize.
Unmute. Madam, unmute.
Yeah. Thank you, Komal.
Welcome, Ramani ma'am, and please announce the prize of mouth-watering iron-rich recipes.
Yeah, and share your experience about judging.
Yeah, actually, I should say all the recipes were very good, but this particular recipe, what you have shown here, that was more appealing. Also, it is not only the value, but the preparation and the display was good. And this is for the third place you have given. No, this was also very good, taking into consideration all the nutritive values. Some of them have put a platter of what the anemia free should be given to the pregnant woman. So very novel ideas they have had, the participants. It was not an easy job to judge these recipes. Go ahead. Go ahead.
Next. Yes, madam. This is the second prize.
Second one. Then the first one?
The first one is, it was third. Now we are coming to second.
Yeah.
We are going in the ascending.
Yeah, yeah.
First the second, Dr. Varsha Ghate, Akola. Now show the first one.
Rajal Thakur. This was almost, these are the top things whom I also had judged.
Yes.
It was also very good.
So this is Dr. Rajal Thakur showing step by step all the recipes and how the ingredients and the nutritive value and everything.
Yes,
so that was displayed very well. Thank you.
These are muthias. These are muthias. Wow, so lovely. Green chutney, delicious snacks. And it is from Gujarat. Congratulations to Dr. Rajal Thakkar and all the winners. So mouth-watering. Thank you.
Thank you. Thank you, Dr. Ramani madam. You have done a mammoth task of judging so many recipes which have come. And we would like to really thank you from the Medical Disorders in Pregnancy Committee, and would hand over
Please send the message to the winners that they have to send all these things to all of us.
Yes, they have to prepare for all of us. It is not just.
Thank
Dr.
you
Ramani
for
madam.
the opportunity. I should thank you for the opportunity.
Thank you. Congratulations, madam, and thank you very much.
Thank you.
Yeah, I would like to. Sorry, madam. Continue.
Yeah, on behalf of the committee, madam, please accept the digital plaque, and thank you so much, madam, joining in. I know you were traveling, some connective issues and other things, multiple things, but you made it on the right time, actually.
Yeah.
Thank you so much.
Thank you.
Yeah, I would like to thank the coordinator, Dr. Kanchan Prasad. She's associate professor and a very active member from Muradabad. Thank you for coordinating with Dr. Ramani Devi madam. And now I request them to proceed with the next contest. Coordinator.
Thank you, sir.
very
Thank you
much.
for giving me opportunity.
Thank you very much, Dr. Niranjan. And now we come on to the Rangoli competition. And I must say that we received a huge response for the Rangoli competition from all over India. And we had in total 49 Rangolis for the competition. And our judge, Dr. Nandita Palshetkar, we are very grateful to her for giving her valuable time and judging the Rangolis. So may I request the support team to display the video? See, we shortlisted some Rangolis because we had given a theme, and those Rangolis which fit in the theme we shortlisted, and we had made one video of those. So the support team, I would request to kindly display those Rangolis through the video. Komal, did you receive that?
Yeah, I have received the video. Mr. Amit, I would take the opportunity to thank.
Yes, ma'am.
Yeah,
Just
Dr.
a minute.
Amit. He has been really, he's Dr. Amit. He's from the MPR team, but has worked really hard for the program. So he has all the videos. I have sent the video.
Yeah, just give me 1 minute.
And I must say, yes, Komal, you will agree with me. All Rangolis were really very good, and it was a tough time to judge. And many of the participants actually use jaggery and green leaves and all to make the Rangoli, and very innovative ideas the participant had. So again, it is amazing to see that our doctors are not only, the professionals, but they are artists, and they are so innovative, and their expression is so beautiful. So again, I would like to thank, as the coordinator, I would like to thank all the societies who participated in the Rangoli competition. And please display the video.
Yeah. Just
We
a
have
minute.
not
I'm
included
just.
all the Rangolis, only those we thought that, really match the theme so well.
Dr.
Just a minute.
Nandita,
I'm just
also,
sharing.
she
No
is
problem.
traveling, and we just spoke to her. And I know with Dr. Nandita, when she said I could judge, like they were all the very class apart, and everybody has done so fabulous job. And we will definitely make a booklet or a folder, and we would be displaying it to everybody. Those Rangolis who have all participated in such a big way, because the first of its kind Rangoli contest has been done by FOGSI.
Shall I share?
Yes.
Yes, please.
No, we can't see on the screen.
No, we cannot see.
We can
Can't
only
see
see the screen.
So you have to open the video first.
And then
I think, yeah.
Open it.
No.
Click
Amit,
right.
you will have to stop sharing, and once you press share again, please choose the option screen.
Komal, this was your one of the best idea of getting this Rangoli competition done. And I think the Rangoli is a most colorful way of welcoming the guest in Diwali, and it's a sign of good luck also.
Yes.
So good luck for you and your committee.
Thank you so much. And we know that
Dr. Archana, you will appreciate when you see the rangolis, you know.
And when you are in the auspicious month of Diwali, and this happens to be the awareness for the anemia free. And what better to keep a rangoli as a point of welcoming everybody. And it was
yes, Rekha Tarde ko to मैंने kidnap ही करना है.
And you know what, the idea that rangolis are done usually by females, but this idea has come from Dr. Niranjan Chauhan.
Oh, that is then it is okay. Because na Diwali pe you Dr. Niranjan ki puja and Ganesh puja and all this.
Yes. So may I have the video now?
Make it full screen.
Wow.
That colors are there, and then actual flowers, leaves, green leaves, beautiful depiction. This one is very beautiful. All innovative ideas. Here we can see the grains also have been used. This is Nabha Society. This is Amravati Society. Nagpur had almost 4 entries. Sona nahi, loha hai mera kehna. Very beautiful. Let's look at the center part. So drop of blood with mother and baby. So again, very beautiful. This is Reiki. I think this was very innovative. Reiki Chakra for anemia. Kushan Abhiyan. This one is made up of green leaves, jaggery.
लाल पाव, ये तो बहुत ही अच्छा है. ग्रीन द रेड.
हरा खाओ लाल पाव. तो बहुत ही सुंदर सारे थीम्स थे, बहुत ही अच्छे थे. और मैं तो एकदम हैरान हूँ और आई एम अमेज्ड कि इतना सारा टैलेंट फॉक्सी में है, इतना सुंदर सब कुछ. और सबसे बड़ी बात तो मैं कुछ सोसाइटीज का नाम लेना चाहूंगी, जैसे जबलपुर सोसाइटी, इंदौर, नागपुर, अमरावती. और नभा सोसाइटी ने सबसे ज्यादा एंट्रीज भेजी है, तो उन लोगों को भी बहुत बहुत धन्यवाद हमारी तरफ से कि आपने इतनी एनकरेजमेंट हमारे लिए की, इतने एंथुजियाज्म के साथ पार्टिसिपेशन किया.
This name we cannot read this something.
Yeah, and yes, please, Dr. Archana.
अर्चना मैडम, आप कुछ बोल रहे थे.
This there is some this thing black on the name is not visible to.
Yeah. Just remove the screen. Na, we can't see the entire slide. When you're sharing, na, there is some black on the top. Can you just remove that?
There is a black bar. Now at least name is visible. Yes.
Yeah.
This third prize.
As Surekha said that it was a tough job, but I think they have made the tough job very easy and have aptly chose the best Rangoli with the best message. You know, the message is very important, and the third prize goes to from Devli Savangi Obstetrics and Gynec Society, who is depicting a woman as a whole, that is a womanhood. And very beautifully written, red should not be the color of the clothing, but in blood, build HP, more than 12, that life will be all well. And that is the mantra which is the must for everybody who is, specifically for the woman, it's for everybody, but for the woman, who are going to enter pregnancy or motherhood, or who are at any stages of their life. So it is very well depicted that a woman doesn't, she just lights up the house considering and each and everyone's need and expectation. But when it comes to her own health, she shows back, neglecting herself, leading to problems like anemia. So it is the well chosen third prize winner. And there is a lot of black coming. I can't see the next Rangoli. Can I have the, that is Dr. Amruta Kathi from Jamnagar. And this is a 3D realistic Rangoli. If you actually zoom this Rangoli, this is real work. I was really amazed that is this real Rangoli or something? And it is, everything has been made in a 3D manner. The food, even the FOGSI logo has been made here, and a message with a mother on one side, a fetus on the one side. So it is really highlighting the importance of consuming iron-rich food during pregnancy to prevent anemia. There is a mother and a fetus with food that is going to keep both of them healthy. And the red is the idea that red, we require blood in it, and eat iron, kick anemia is the message. And this is a beautiful 3D. One should actually zoom. I'll share all these on a social media. You can zoom and see it, how beautifully the colors are used in this rangoli and everything.
चलो ना कोमल फटाफट बोलो थोड़ा, we are getting late also.
Yeah, injection, FCM and all the food articles. And now may I have the first prize? The first prize goes to Dr. Pooja Kati from Raipur. And this is the rangoli which is depicting everything we do in anemia, regarding from the preventative aspect to the treatment aspect, and the delayed cord clamping, the anemia iron tablets, everything is displayed. A beautiful rangoli by Dr. Pooja Kati. So this is Khajur Khao, anemia se dur raho is her message. And congratulations to all the winners.
And thank you to Dr. Anita Palshetkar, who judged the Rangoli competition.
And may I now call Dr. Aarti to call in our next judge?
First of all, congratulations, Komal, dear Dr. Archana Verma, and the whole team. It's been a wonderful program. In fact, we didn't get to know about the time, the way ma'am has said that, because everything is so interesting, all the recipes, the rangolis and slogans, amazing. I would like to invite Dr. Sudhir Shah to tell us about his final decision about the community prizes. And it's my proud privilege to invite Dr. Sudhir Shah, who's a senior obstetrician and gynecologist from Rajkot since 40 years. He was associate professor at Baroda Medical College for a few years. He has authored 8 books published by JP Publication. And at present, Dr. Shah is National Correspondence Editor in Journal of OBGYN FOGSI. And he's one of the chairmen of FOGSI Media Committee. Dr. Shah, sir, let us see what have you judged for us in the community participation. Over to sir.
Hello, am I audible?
Yes, sir. Yes, sir.
First of all, congratulations to Dr. Komal, Dr. Archana Verma, Dr. Niranjan for organizing a summit on anemia of pregnancy, and almost everything has been covered, not once but twice. So I think no snippet from me. I think I should go for declaring the result regarding the prizes for community activity. I feel all the societies under the banner of FOGSI has done their level best to contact and to brought up the awareness in women healthcare to all the things required for health workers to the targeted patients. And we hereby, on behalf of Medical Disorder Pregnancy Committee and FOGSI, appreciate and acknowledge them all. Having received the official report from the following societies, the prizes for outstanding work for the community activities are follows in the alphabetical orders. There's no 1 or 2 or 3, but in alphabetical order, the societies are Ahmedabad, on alphabetical order, then Agra, then Amravati, Aurangabad, Chiplun, Gwalior, Haldwani, Jabalpur, Mumbai, of course, Nagpur, and OGSSI Chennai. So these are the results. I again thank you very much to the coordinators and the Komal, the chairperson of the medical disorder of pregnancy. Thank you very much.
Thank you so much, Dr. Sudhir Shah, sir. And it was a decision to be made that a community, when you reach out to community, every step you take towards community itself is a prize. It cannot be judged because you have made an effort to reach a community. That itself is commendable, and that we all thought. And I really thank all the people who have taken a step forward, reached out community in this whole month, and shared to the community the importance of anemia and to make every pregnancy anemia free. And I thank all of them who have participated in the community activity. Thank you so much. There are few more who have participated but have not sent a report, and so I couldn't include them. But I really thank for all those who have made this campaign possible. Thank you so much.
Komal, if I may say, can you just take few names so that you can acknowledge them? They are all live listening to you. From Agra, there was Dr. Niharika. Hello. No, you have to unmute yourself.
Dr. Niharika from Agra, from from Ahmedabad, Rajal Thakkar from Aurangabad, Dr. Gurpreet Sandhu, then Viral Madam and Shashkala from Gwalior, then Chiplun, there is Dr. Kanchan Madar from Mumbai, Dr. Anaita Chavan, Dr. Tushar Palve who did the program for Mumbai, and there are Haldwani, Dr. Kanchan Rani, she has done a beautiful job. And there were Nagpur, Dr. Shama has done from Nagpur, Dr. Aurangabad, even Dr. Manisha Patrekar, she had a radio talk show. And there are many more. I'm telling you, there are so many. So the list has already gone, but I really want to thank each and everyone who has done the effort to go to the community, and that effort is really, really commendable. Thank you so much.
Yeah. I request you to please hand over the plaque to Dr. Sudhir Shah.
Yes.
Support, please show the digital plaque.
Oh, thank you.
This is on the behalf of FOGSI Medical Disorders Committee. We thank Dr. Sudhir Shah to be our esteemed judge and a faculty for this anemia-free pregnancy summit. Thank you so much, sir, for being here. Thank you.
Thank you very much.
Thank you, sir. Thank you, sir.
Thank you very much.
Thank you, Dr. Sudhir.
Thank you.
This is for the best participating society.
I can say only one word. Komal, tum jaisa koi nahi. So you have made this anemia program a super hit program, and so many societies and so many faculties and so many VIPs joining this. So this has become a landmark in FOGSI committee work as far as this any program is concerned, and you have made anemia something as if like I am thinking, how come we are not after anemia? बिकॉज एनीमिया को तो भगाना ही होगा और आज के तो प्लेज ले ही लिया तो
Amit, if you can stop full sharing, just go to not to the full sharing. Sorry, madam, to interrupt you.
Yes, madam.
So now now should I just tell the so many societies who have done really wonderful work, Komal, as such? So Jabalpur was found, I really appreciate the way in pandemic, so many this participation, so many members have participated, and this Jabalpur has done wonderful work of motivation. Each member matters, and if they are suppose 100 in the society and 100 are participating, that is the best. So Jabalpur has sent.
Madam, third se chalu karo. Madam, third se chalu karo.
Amit,
Oh yes.
yeah.
Oh yes.
Amit,
This is ascending
please,
order.
Amit, please share it, but don't share full screen.
Please share.
Don't share full screen. Just show, yeah. Go from the, yeah. That's what I'm saying. Yeah.
Yes. So ascending order. The Nabha, Dr. Komal and everybody and Dr. P.K. Shah, we tell that Nabha is a very small society, but such a enthusiastic participation from them, and they send fabulous entries. So the third prize goes to Nabha Patiala. Congratulations to them. And now the second has been bagged by, there's a tie-up, and there's one is Aurangabad. They took part in all activities. They did radio talk show and targeted maximum community. This Aurangabad is a wonderful society, and congratulations to them. And another second one, just a change.
Next slide.
I think first one.
Next slide. There's a tie-up for the second, na? Yes. I congratulate Gwalior Society.
There is Jabalpur is been first. Okay. He has not made a slide.
Okay.
Yeah.
There's some
technical error. So
there's some technical error. Okay. But the second is a Gwalior Society, and their dynamic president and secretary, and we know Veera Loya and Pam leading the society, and they did the fabulous work promoting activities with the maximum participation, and congratulations to them. And another again from Madhya Pradesh, it is Jabalpur Society, which is very close to my heart, and the main city and main very famous society from Madhya Pradesh. And they did the work in a very, very detailed format, which was expected from each society. And they conducted internal contests also to choose the best thing to send the this entry. And they participated in all the activities, and it was really wonderful. So Jabalpur, congratulations for being first. So all these societies, how many total societies, Komal? I think more than 100?
Yes, yes. There were so many societies who participated in at least one of the other activity. Everybody has participated, but there are many who have taken a thing in them, and they have participated and shown maximum participation and done very enthusiastically. Actually, all the societies who got the best society award have participated and done the best, but Jabalpur have then meticulously pointed out and made a nice report, the PPT and everything. They shared it in a very well way, in a very organized fashion,
very
and
organized. That is very
they stand
yes.
ahead of everybody. But all the other societies have done
so
equally great work, and they have really taken efforts to spread the message.
Because it is like the same quantity and quality both maintained.
Yes, yes. So it was really nice, and definitely all societies, and we still, it doesn't stop here, but we need to still continue.
Definitely we have to take it forward. And Dr. P.K. Shah, what do you think? This anemia program, it should get that Limca Book of Record program.
Sir, your views.
Sir, your views.
No, I'm really happy, and I enjoyed it.
Yes.
Let me tell you honestly, because it was from 5 o'clock. We are almost at 8:45.
Yes.
It's a long program, but it was only because of this couple, Komal and Niranjan, that whatever they do, it has a meaning.
Yes.
And it has a message. And that is what I like the best.
So we
about
celebrate
this
the
couple.
success
Thank
of
you, sir.
Komal and
Thank
Komal.
you.
Thank you. Thank you so
Three
much.
cheers to
Fantastic.
you. And we really gold medal बोल तो सकते हैं gold medal goes to Komal, and definitely we will give whenever we'll meet. So
Yes.
I never say no to these two people when they ask me to do something.
हाँ.
So you can imagine.
Thank you.
You can
Thank you,
imagine
sir.
the faith I have in Komal and Niranjan.
Thank you
Thank
so
you,
much.
sir. Thank you. Thank you, sir.
All the best. And Archana, for the first time, I have seen you sitting all throughout.
So that with that shows the value of importance of the program. So
Thank
even
you.
I'm thinking this is going to be that Dr. Hima rightly said bar. So that bar that is a bara bar. So that I like the
Today's
sentence.
Saturday night.
Yes.
So I hope this bar is not meant for anything else.
Bar is raised. Raise the bar.
You raised the bar.
To raise the bar.
Good. All the coordinators were fantastic.
All the coordinators were fantastic.
Thank you.
Really,
Very good.
really would like to thank Dr. P.K. Shah sir specifically for sitting. He's been our guru, our teacher, our mentor, and sir has always been a pillar of strength. And sir is so supportive and always present and always guiding us. So thank you very much, sir, from bottom of my heart. Deepest gratitude to you, sir, for being here and really encouraging us, and your comments about the panel and everything has really given us more motivation and inspiration and to go ahead and do. Thank you so much, sir, for being here. And I would like to conclude the program with a formal vote of thanks. As a chairperson of FOGSI Medical Disorders in Pregnancy, it was a great experience to lead this campaign, the Anaemia campaign, in the month of November. And it wouldn't have been possible if the cooperation and the support and the encouragement which I have got from Dr. Archana Verma. You have been really a great guiding force in it. And yes, and she is always a leader, and she is a leader and a pioneer who has started all these awareness activity and wherein everybody is now following it. And she is a great leader. So definitely, madam, it is real an opportunity to work with you. It was
So even I'm thinking, like Dr. P.K. Shah is a brand of this Bapu word lightly given to him. So I think I will better we go in awareness only, awareness, and awareness.
I know that was rightly said by Dr. Sudhir Shah also, and I would like to thank our president, Dr. Alpesh Gandhi, for being here, sharing his views. Vice President in charge, Dr. Atul Ganatra, Dr. Jaideep Khan, Dr. Rishikesh Pai, Dr. Madhuri Patel, all the office bearers have joined, they have waited, they have been a part of the program, more than half of the program, and they have been with us. So I thank them from bottom of my heart.
अब डिनर हमें खुद खाना, अब न्यूट्रिशन और डिनर का इशू है. अब
Yes, and Hema Divakar madam for the Power Pack panel with all the organizations who have joined, the UNICEF, the NIF, HFW, the NNF, API and IPHA, all the panelists who have joined along with Madam Dr. Ajmer Gayam, Dr. Harshad Thakur, Dr. Mangesh Tivaskar, Dr. Pejevar and Dr. Kapil Yadav for making this a memorable panel discussion, which was really appreciated by everybody. And to top it off, we have had a guest speaker, none other than Dr. Rekha Divakar. In spite being a mother of a celebrity, Rujuta Divekar was so humble and she shared her views. And I thank Dr. Rajendra Nagarkatti for being here to chair the session of Rekha Divakar along with Dr. Pavandir. Thank you so much. And I thank the program would not have been complete, the entire campaign, without the cooperation from the esteemed judges, Dr. P.K. Shah, Dr. Narendra Malhotra, Dr. Nandita Pachetkar, Dr. Ramni Devi, Dr. Krishnendu Gupta, and Dr. Sudhir Shah, who have been all the time judging, and they have done a fabulous job and chosen the right.
Dr. Rajendra Nagarkatti bhi.
Yes, he's always there. And the
Thank you.
coordinators for the program, everybody, Dr. Surekha, Dr. Shashibala Madam,
आज कोमल को नींद नहीं आएगी. Today she will not sleep with the success.
Kanchan Prasad, Yogi
Niranjan,
I think
take care.
Aarti, They all have done such fabulous job, and the great team I have found, and they have really done wonders and worked very hard. I thank you all from bottom of my heart. Dr. Subbu, Seshan, Shrimon from TOG Science Integra. Thank you so much. You all have always been
Medical
guiding
disorder making every mother safe.
Safe, yes. And MCure team, Amit, Kedar, and thank you so much for being with us and supporting this activity of FOGSI and the IMAMS app, M3 India, everybody. Thank you all. Thank you.
Don't take anemia for granted.
Yes,
Don't
and
take
thank
anemia for granted.
you all participating society presidents and secretary who have enthusiastically
प्राइज मिल गया पार्टी की तैयारी करो.
Thank you, thank you.
Thank you so much. And thank you,
Best
Dr.
Thank you, sir. Thank you, madam.
Dr. Rajendra Nagargatti for being the
Rajendra Nagargatti section करके वापस आ गए.
No, he is my true friend and co-chairperson. Thank you so much.
Thank you,
and
you.
we have
Komal, wonderful program.
The present and the future of midlife management. So thank you so much.
Thank you so
Thank you.
Thanks a lot.
Thank you, sir.
All the best. Thank you.
Thank
bye.
you.
Stay
Thank you,
safe.
Archana ma'am.
Thank you,
Stay
love.
safe. Thank you so much.